So we're at Veterinary Village today for our health clinic. And even with all the years of experience in this room, I am hoping that at least once during the presentation today, you have an aha moment that you say, really? I didn't know that. So that's tricky to do. Come through that, Helen, I'm sorry. No one really. It's okay. So I want everybody to have an aha moment. And when you have that aha moment, stop me and tell me, because I think it's kind of fun to figure out what it is that you knew or didn't know. So what you didn't know about breeding dogs. So Virginia Apgar. What do we know about Virginia Apgar?
She was the one that did the thing with the human babies.
Right. Yeah. With human babies in the 1950s, she developed a process. So she graduated from medical school in 1933. You know how many women went to medical school in 1933? There was probably 1 in 4 classes. She was probably 1 in 400 people. Very, very small number. And she was told that she could not be a surgeon because she was a woman. So she said, okay, watch this. So she became an anesthesiologist. She was here at Wisconsin for a period of time doing residency or specialty. She was in New York City. She was the first female board certified anesthesiologist. And in the 1950s, she developed the Apgar scoring system. And I would venture to say everybody in this room, I was born in the 50s. Everybody in the room born in the 50s and since has been Apgar scored at birth. And you're scored at 1 minute and 5 minutes at birth. So she was amazing. In 1952, she did this. And this is the time that a lot of us, our mothers were anesthetized for our birth because they didn't have good pain medications. We didn't do natural childbirth. Our mothers, your mother may not tell you that, but she was probably anesthetized. So that's why the anesthesiologist, part of Virginia Apgar, got involved. So I've asked vet students who they think is in this picture, and they've said me, and I'm like, well, do you mean like this one or this one? Like they pointed to me, I'm like, no, I'm not. I could have been this one because I was born in the 50s, but I was not this one. So Apgar stands for Appearance, Pulse, Rhythmus, Activity, and Respiration, Apgar. So this woman brilliantly turned this into a name that was her name, and now we still talk about Virginia Apgar 60, 70 years later. Very smart lady, right? Who remembers any of the surgeons' names? Nobody, but we know Virginia. So we have now had it modified by Dr. Rick Cutsworth, who is a theriogenologist on staff at Minnesota, to something we can use for dogs. So again, it's still APGAR, activity, pulse. We don't have babies that grimace. They don't make little wrinkly faces, so they use reflexes. Then mucous membrane color and respiratory rate, so APGAR. And you get stored on 0, 1, or a 2 on all 5 of these parameters. So if you're born screaming, crawling out of the uterus, wailing, pain, great heart rate, you're a 10. And I have staff, as I'm handing off puppies at C-section, they'll be calling it out already. They'll be like, this is a 10. So they're very excited they have 10s. If you're born dead, you're a 0. And I've had 2 people in my audience before, 2 women that have said, my human baby was a 0 and he's still alive today. So with the right support and identifying what's going on at birth, you know, in the 50s, these babies died. Like physicians and pediatricians stood there and watched them die because they didn't know what to do. Well, the scoring system was the first step in intervention, because if you don't have a way to communicate the score, you don't have a way to. So it's changed. So we have lots of puppies that are born at 7, 8s, and 9s. A lot of them are born at 10s, even at C-section. If you're born at a 0 to a 3, you need a lot of help to get going. And sometimes they do, but sometimes they don't. So in the last 10 years or so, Neocare at the Toulouse Veterinary School in the south of France has done a ton of research on newborn puppies and newborn kittens. And so they've given us a bunch of numbers, and that's what these numbers that I'm going to put up on the screen are from. Is these aren't already Greer said. This is what they said at Toulouse with the veterinary school, and they have taken 10,000 measurements. They have vet students involved. It's pretty cool. So puppies born with an Apgar score of less than 7 have a 22-fold increased risk of death in the first 8 hours after they're born. It's pretty significant.
Mm-hmm. Yeah.
But if you have a 4 to a 7, with appropriate interventions, we can get 90% of those puppies to survive. And so if we have the number and we know what our interventions have to be, we at the veterinary clinic and you as a breeder can really change the outcomes of these puppies, because we're not just going to stand there and watch them. We're going to know what to do. So that's APGAR scoring. I have an intervention sheet that goes through 14 parameters. APGAR is one of the 14. So it does go through all the interventions that we can do: oxygen, fluids, plasma, feeding, antibiotics, all the stuff. So if you have a puppy that's in trouble, then by all means, get in touch with us, because all of my doctors are really good at interventions on these things. So, any questions about APGARs? Shall I keep going, or do you want to talk about something else besides what's on the screen? Okay, we'll do next. So, who knows what Silencia is? Who knows what Librela is? There are two monoclonal A antibody interventions. Silencia is for cats, Librela is for dogs. That's a monoclonal A antibody that affects nerve growth factor and therefore pain associated with arthritis. It's an injection, it's given every 4 weeks subcutaneously, and it does a tremendous job of improving mobility in our older cats and our older dogs, maybe not even older, but dogs and cats with significant arthritis. It does an amazing job of improving their mobility by affecting nerve growth factor and then pain. So these dogs and cats are up and moving around in a way that you have never seen before. It's so good, in fact, that the company then came out with another website called Back to Play, because some of these dogs were feeling so good that they were going back out and running in the yard without being reconditioned, so that they weren't in good physical condition, and then tearing a cruciate because they were over exuberant about their newfound mobility. So it's a great pairing of drugs. It is a monoclonal A antibody, so it's a different drug class than we've seen before. Does anybody know the other monoclonal A antibody treatments we have on the market for dogs? It's for parvo. It's the monoclonal A antibody treatment for parvovirus. Has anybody ever had parvo? Keep it that way. It's pretty horrible when it happens, but we now have a monoclonal A antibody that one injection will save the lives of almost 100% of the puppies that get parvo.
Really?
If it's given in the first few months, yes.
First few hours?
Yes. Yes, and it comes frozen. It's available at a limited number of veterinary clinics, ours included, because we really feel pretty passionate that if we're going to do neonates and young puppies here, that we need to have it accessible. I have used it a few times. I used it on 30 of my own dogs when it was coming to market for safety studies. I had 2 litters of puppies at the same time. So I had a litter of corgis, a litter of farm dogs, and all my adult dogs. Everybody got it. Very smooth injection. It's given intravenously for puppies that are sick. But if you have one sick puppy and you're concerned that the rest of your litter is also exposed, it's given at half the dose subcutaneously for the litter mates or other dogs in that vicinity. So again, we have treatments that we've never had before. These are really new things that have come to market in the last 3 or 4 years. So truly amazing improvements in what we can do for dogs and cats. So this is the parvovirus. It's called Kind 30. It's still conditional use, but it is truly an amazing product. Elanco makes it, and they've got it. They've got a whole campaign now that they want to save, I think it's 300,000 puppies in the next 10 years, because they want to be able to intervene and prevent puppies from dying from parvo. Back in the day, you remember what it was like. You put the puppy in the hospital, you put them on fluids, you put them on Serenia, you put them on Convenia, you put them on all this stuff, and still we lost about half of them. But we're not losing puppies anymore to parvo. That doesn't mean you should get lazy and not vaccinate. It just means if you think you have parvo, or if you're on a call with a friend or on Facebook with a friend and somebody says to you, I think I have parvo, get them in, because we can save them.
Yeah, new,
Good.
new breeder, first litter this
Well,
summer.
we don't want to scare you.
No, I'm just curious, how do they track the parvo? Where does it come from?
Fecal oral, so it's typically from
From other
exposure.
dogs?
Yes, from other
Okay.
dogs, yeah. Yeah, I was talking to somebody the other day, a veterinarian the other day, and I said, well, you know, with parvo, yeah, raccoons, wildlife can carry it as well as humans.
Okay, that's what I thought, because I know somebody in the Jack World, they lost a whole litter.
Right, and raccoons use raccoon latrines. Raccoons just don't randomly urinate, they have a latrine that they go to. So lepto, parvo, some of those diseases, if we can find the raccoon latrine on your property, and the Center for Disease Control has a page on their website about how to do that and how to get rid of it. Raccoons just don't randomly go out and poop somewhere. They have a latrine. They would walk 10 miles to go to the latrine.
I didn't know that either, but this woman was.
There you go, there's your-
devastated that she
There you go.
wanted to pack everything up and move somewhere else. that's how devastated she was when she lost her puppies.
Yeah, and it's pretty devastating. When we were in vet school, is when parvo was, it started. It was a mutation, we think, from feline panleukemia. And I was saying to somebody, a veterinarian the other day, you know, when parvo started, and they go, what? I said, you know, when parvo started, and they said, what do you mean? I said, in 1978, we didn't have it, and in 1979, we did. And they looked at me like I was a dinosaur. I'm like, no, I was there. We had dogs that came into the vet clinic at Iowa State when I was in school, that would come in hit by a car or come in with kidney failure, they died of parvo because there was no vaccine. And the first vaccines that we used were feline panleukemia vaccines. We didn't have parvo vaccines. Clients would come to the door and they would open the front door of the clinic, and if they could smell bleach, they'd get back in their car and drive away because they knew that parvo was on site. It was a big deal. We lost puppies right and left in the early 80s, late 70s because of parvo. Pretty bad disease, but now we have genuine treatment. It's the first infectious disease monoclonal A antibody treatment we have for dogs. It's pretty good. All right, y'all. What would you use Nair for on your dog? Hair removal.
Hair removal
Yes, hair removal where?
on their belly?
In their ears.
Oh.
So for those of you who don't have hairy eared dogs, you don't understand this.
know that.
But if you have dogs that need to be groomed, the curly coated dogs, poodles, Bichons, Schnauzers, Portuguese water dogs, dogs that grow hair in their ears, you can put Nair in their ears instead of plucking the hair. You can put Nair in their ears, and then you can very gently pull the hair
I
out.
think that was an aha moment for everybody.
No.
I think that was an aha moment for everybody.
Yeah.
Okay, who knew that?
No.
Who knew this? Okay, so this was aha for everybody. Okay, so at least I got my one aha. Even if I don't get anything else out of this. Okay, is this your first aha?
No, I had the aha,
She had
Parvo.
You all know that.
Yeah, and hopefully you never have to find out that it's in the freezer right behind you. You know where the chips are? You open that, it's right there. I hope you never need it.
How would you apply this to the ear?
I use a Q-tip and put it down in a small amount, because if you put in a big squirt and then they shake their head,
Yeah.
it flies out and it runs across your face and you need your eyebrow, I am not responsible.
Just how much would you use though?
Just a little squirt. Yeah, just a little squirt, leave it in about 15 minutes, go back and take a Q-tip and just kind of spin it around, and the hair lifts right out on the Q-tip.
They'll be happier.
And you may have to do it 2 or 3 times if the dog's got a really hairy ear. But once you've got the hair under control, you can keep up with it. So I usually use the aloe based one because it's a little bit more soothing. All right, this is not about this box that's there. So why is this puppy hanging out with this stuffed octopus?
Singleton,
What's that?
a singleton?
It's a singleton. Why else? What do we use the octopus for?
Comfort.
It's
So they don't end up with flat chests.
exactly right.
And it's not because I have never had a singleton.
So these tentacles, I don't know why, but the puppies love to curl up on those. And those puppies that end up laying really flat, especially the puppies that gain really quickly, like the bulldogs and some of them, they get really flat chested. They're born round, and within a day or two, they'll get really flat and then they can't breathe. So if we've got them on these, if we give them these octopuses to crawl up on, they don't get flat chested. The alternative is egg crate mattresses. So you can buy those big sheets of them and then cut it into pieces that fit into your wellbeing box, or in this puppy's case, it can be better.
Or you can buy, sound foam, and they actually come in rectangular pieces, and you can place them that way.
Right, this is the foam you put in sound studios and stuff to get the noise down. But these things work really well, and this thing washes much better than sound foam. Yeah, the little octopus goes in the washing machine, so I always have 2, one in the, with the puppy and one in the wash. That's what they look like when they're flat chested. So this is the puppy's head, that's the puppy legs, that's the belly, and that's how caved in the chest will look on some of these puppies. They don't breathe very well.
Yeah.
Can you imagine? And it doesn't just happen in bulldogs, it happens in dogs. All right. Ibuprofen. Why do dogs eat ibuprofen?
I have no idea, but I had one.
But it happens a lot, yes. Anybody know why?
The cold.
sugar coated. Yeah, the coating on the tablets is sugar coated, so the dogs will think that it's pretty tasty. So they'll get into your purse, your backpack, the pill you drop on the floor, whatever. One pill's probably not gonna do them in, but when they eat a whole bottle of it, it's very dangerous. These dogs will get sick, they're going to kidney failure, liver failure, it's pretty serious. So. What about trying to go? And what's wrong with it? Xylitol, exactly. Xylitol. What's the other name for xylitol?
Birch sugar.
Birch sugar, exactly. So you may see on the label birch sugar instead of the word xylitol. Xylitol starts with an X. If dogs eat a little bit of this, their blood sugar will drop, they'll start to get wobbly, like just uncoordinated, kind of looking like they're drunk, kind of looking like they're on marijuana or sweet tubes. If they get enough more of it, it puts them into liver failure. So these dogs need ice cream as fast as you can get it into them, because their blood sugar high, and you need to get to an emergency clinic where they can appropriately treat the dog and get blood work so that they can determine if the dog needs to be hospitalized for the liver failure. I have never found peanut butter at the store that has xylitol in it. I don't shop at fancy stores, I shop at the Piggly Wiggly. They don't have, I don't know where they sell this stuff that has xylitol in it instead, because I've never found it, but maybe you guys shop at Whole Foods, Whole Paycheck. Yeah. Maybe you do, maybe you don't, but I've never seen it, but xylitol is pretty common. It's also not all that uncommon in certain other products. We've had it in melatonin, like people have started their dog on melatonin to grow hair, to get them to sleep better or whatever, and it'll have xylitol in it. Watch your Benadryl labels, watch all those over-the-counter products that kids and adults take, is they may be putting xylitol in as the sweetener to make it more appealing for people that don't want sugar in their kid. I mean, if your kid needs Benadryl, sugar is the last problem. All right.
I have a question. So the xylitol, when it's ingested, it lowers the blood sugar.
Yeah, the blood sugar drops precipitously.
Okay.
I was on the phone one day, I had a client that called in and she said, I've got a boxer and he's acting really strange. I'm like, what's going on? And she said, he's like staggering through the house, room to room, like he's drunk. I said, okay, what did he get into? And she's like, I don't, and she was following him through the house. I found him. I'm like, okay, bring him in. So I said, bring the package, and the dog had chewed up enough of the packaging that I couldn't read it. So she had put her husband and her son in the car with the dog and said, go. And she came in the second car, stopped at the store, picked up a package that I could read. Like, she was so smart, she was way ahead of me. Because it never occurred to me to tell her to stop and get that. But if your dog eats rat poison, if your dog eats xylitol, if your dog eats CBD juice, if your dog eats anything that you're not sure, you need to call poison control. And then if they tell you to go into the vet clinic, then follow their directions. So poison control, National Animal Poison Control is part of ASPCA, and Pet Poison Helpline are the two helplines that we have to call. There is a charge for it. It's usually around $100.
Yeah, it's $100.
But
That's
cheap.
You could save your dogs.
Yes. But it may actually save you more money in the long run, because if you call in and your dog ate a half a package of Reese's peanut butter cups, and you tell them how big the dog is and how many they ate, they can calculate for you whether that's even a toxic dose.
Correct.
So very quickly they can tell you that. And people are kind of offended. They're like, well, why do I have to pay for it? Kids are free. The kids is funded by your government. They don't fund the dog helplines. That's up to us as dog owners. So have your credit card, give them a call, have that phone number in your phone. Because if it hasn't happened to you, it will eventually, or a friend of yours. So National Animal Poison Control and Pet Poison Helpline, they're both good. They both have toxicologists on staff. And then they will give you a case number. And they will say, this is your case number, so when you go to the
The
vet.
800 number, I have to make it.
I have them in my
Yeah.
phone, but I just didn't realize that it dropped. the
Yeah.
sugar.
Oh, yeah, they drop to the point that they'll seize you because their blood sugar is low. Yeah, it's pretty profound.
Hypoglycemic.
Yeah, and the other one that we see a lot of, we've been seeing a lot of is CBD, THC, marijuana. I had a puppy in 2 weeks ago that we're pretty sure got into marijuana. And it's a little bit of a challenging conversation to have, because the woman was there and her teenage son walked in right behind her, and I looked at him and I said, you have to be honest with me. He's like, no. Well, the dog had been in the alley out back of where she was working, and she said the dog was licking on a piece of paper, and I'm sure that's probably what it was, is it was a joint. But it's not always the people in the household that have it, although I did have a staff member my dog that I own that lives with my staff member, got into the kids' CBD shoes. She made it pay for that having a visit. He won't leave the CBD shoes where she can get it anymore. But people with traumatic brain injuries, people that have cancer, there's a lot of people that use it.
No,
And even though it's not legal, I'm not here to judge. I just need to know if you can be honest with me, do you think the dog got into something? And the urine test kits that you can get at the dollar store, I have some of them, but they're not terribly accurate on dogs. And you can buy them at the dollar store for $1.25, like they're not expensive, but it's a urine test and they're not super accurate on dogs, but I still have them just in case.
Yeah.
Yeah. But we saw, the week of COVID, the week that COVID shut all the dorms down, we had 3 cases of marijuana toxicity. Because all the kids came home, shoved everything in their rooms, and then took off with their friends and forgot that the dog would get into the baggies of stuff that they had tucked under the bed. So we had,
Is it easy to get them out of that? Or-
no, you just have to give them supportive care and wait.
Okay.
They probably had a pretty bad headache. I don't know.
And they were hungry.
They were probably pretty much. But one of the things they do is they urinate buckets, like just urinate huge amounts when they have this toxicity. I don't know if their bladder sphincter is relaxed or if they drink more. I'm not sure exactly the mechanism. But the one 2 weeks ago, that's exactly what we said, okay, how much is she urinating? Oh my God, it's just pouring out of her. So that's kind of a hint that something's not right. But I've had people that, you just have to look at it and say, please be honest with me.
Yeah.
Because if you think there's a possibility, I just need to know. I'm not here to be judgmental. I had one pair of young girls that came in, this was a long time ago, we were still in Lemire at the time. And I was talking to them, they had a Siberian Husky, and I said, do you think there's any chance that the dog got into marijuana? And they looked at me and they go, oh no, and as soon as I walked out of the room, they grabbed the technician and they said, don't tell Dr. Greer. And she goes, newsflash, she already asked, she knows. So, just be honest, because it's gonna help to cut down on the treatment. But if you get poison control on the phone and you do have a case, they'll give you a case number. And then if you have to go to the emergency clinic, the case number goes with you. So now they have a treatment plan for how much fluids and what the antidote is, and how much of this and how much of that they can give. So now they don't have to call and you don't have to get charged a second time. And they have a very specific treatment plan that's written out. And so when you hit the veterinary clinic door, whether it's a regular clinic or the emergency clinic, they're going to appreciate you. Because you're going to come in with a treatment plan and they can go boom, boom, boom through it instead of going, oh, I don't know if that's toxic or not. And the other thing is peroxide. Everybody knows about peroxide to make your dog vomit, right? Don't. I've had a cat that died from hydrogen peroxide and a dog that had a stroke from it.
Wow.
She had ear bubbles in her brain and she walked backwards for 3 days at the emergency clinic. So I don't use peroxide. There's a product on the market called Clevor, Clevor. It's an eye drop you can get from your vet. It's a prescription item. It doesn't work on cats. Again, it's a really strange, interesting mechanism that it works on dogs, but not on cats, but it'll make them vomit. So if you have a dog that eats underwear, a dog that eats ibuprofen, a dog that's just, one of those dogs that's notoriously naughty all the time, just have one at home, just have a package at home. It's like $50. It's way cheaper than going to the emergency clinic because your dog is Clevor. It comes in a little foil package. Yep, Clevor. Okay, yeah. All right, so this is an X-ray of a dog. What's that? This is the
Microchip.
nope.
Bill or something?
Quarter. Quarter, it looks like a quarter, doesn't it? You know what it really is? It's a Pepto-Bismol tablet.
Oh, that's.
So you go to the vet, you have your dog, it's vomiting, you take the dog in, they say, well, we should probably take some x-rays because your dog is vomiting. And they see this on the x-ray, what are they gonna tell you? So your dog ate a quarter, ate a piece of metal, ate something, and that's when you take the dog to surgery, right? Take it out. Or make the dog vomit to get it to come out, and then you're gonna find out that it costs you a lot of money for that Pepto-Bismol tablet. So again, if you give Pepto, either get the liquid, or make sure the vet knows that that is a Pepto-Bismol tablet. Before they take your dog to surgery, before they throw them on the gurney and run them down the hall. That's what Pepto looks like. Good on an X-ray. So, keep that in mind. Okay, who had an aha?
I'm done.
Okay, good. Everybody has to have an aha before they leave. You can't.
I'm running a lot of.
Okay,
apples.
what's the difference between puppy light and kitten light?
One's a puppy, one's a kitten.
Yep.
Puppy's a man.
They're both made by Revival. They're an electrolyte solution, tastes like chicken. It's a chicken soup based product. It's easy to get them to drink if they're not, like it's a bitch that just had puppies. She's not drinking enough to make milk. You have a dog that has diarrhea, you have puppies that are sick. They're exactly the same product. But people with cats won't use dog stuff. People with dogs will use cat stuff. So if they're out of puppy light, use kitten light and C6. You already know the answer to this. Some of you already know. Okay, who knows about spinach? Put your hand up. Okay, so my front row already knows. What do we do with spinach, ladies?
They swallow something.
Shove it down their throats, say cold,
Yes.
something that's sharp.
Yeah.
So they ate a thumbtack. They ate a ballpoint
Of
pen.
course, fishing hook.
They had fishing rods with top.
Christmas tree ornament.
Yeah, floral wire, you know, all the stuff that dogs eat. This will wrap around it and help it to come through. Now, a giant towel is not gonna come through. I had a lab have a small towel, and I literally did it myself, because the owner's like, you won't eat the spinach, well, watch this. So you bring out the spinach, push it down their throat, and this Labrador pooped out the towel. Kept him off my surgery table. So it does a remarkable job. Never be without 2 cans of spinach in your house, because you're gonna need it, and the dogs will eat it, right? If they won't mix chicken or beef with it, and then they'll typically eat it. So this is a really good way to get things to come through the dog.
How long did it take the towel to come out?
It was pretty fast. I was surprised, yeah.
Hours?
Less than 24, yeah. Yeah, but
I think I'd be afraid to have a towel in there that long.
May I ask
It's
how
there.
much is it based on the size of the dog?
Yeah.
And
if you have a dog this size, I would use a quarter of a can. If you have a big dog, I feed it until the green poop comes out, because as soon as they're pooping green, whatever was in there with it is coming through. And spinach is slippery. I know people talk about, well, I fed mashed potatoes, or I fed, bread, you know. It oftentimes doesn't work very well. But the spinach does a remarkable job. And I've used it for many years.
I think it's about, it's there.
Yeah, I don't think it's
Yeah.
outside.
Oh, it's not.
Interesting.
I have to buy spinach.
So spinach, I have 2 cans of spinach. I had one guy that I talked to on the phone, and his dog had eaten a bunch of vegetative material, and we were trying to get him to pass it. And I said, well, feed spinach. He goes, I have collard greens. I'm like, ugh, gross. Why would you eat collard greens? He says, oh, I love collard greens, great. Feed it to the dog, whatever makes you happy. So, ballpoint pens. I chew up whatever is available to me when my owners leave. Today, it was a blue ink pen and those glasses. Nice. And my favorite.
Oh.
That is so cute. Very cute, huh?
Stewart.
Okay, what do we do with baby rice cereal?
Everything.
Everything, yeah, it's great for puppies. It helps with diarrhea, you can mix it with baby food, you can mix it with yogurt. So if you have puppies with diarrhea, and you know, we can't use antibiotics for everything. You can't put babies on metronidazole. If you have diarrhea, this does a great job. Just the like, so the
It
stuff
works
with
for puppies and the adults, they are kind of not wanting to eat.
Yeah.
Because if you fed them that as a baby, they remember it.
Right, right, so you can buy this at the grocery store, easy to find. These are exfoliating gloves. What can you do with these?
Hold a puppy that's slippery.
Yes, if you have a big enough bitch, you put these gloves on and get a hold of a puppy. It gives you some traction. If you have a dog this size,
It helps with the new kids.
all right. Before we take our puppy count x-rays, before we do our TCIs, we need our dogs to have a stool. Now, some of you already know this, some of you do not. But what do you do to get a dog to have a stool? It's on demand. Suppository or
Stick match.
matches. Yeah.
It's works sticks.
Please do not use wooden matches.
Oh, geez.
Paper matches. You can put these into the dog's rectum, or you can put in a glycerin suppository, and 90% of the dogs in 90 seconds will poop.
There's no swoosh.
I don't know exactly why it works, but it does.
Or
I
not.
mean, the glycerin makes sense, because it breaks.
I
The
think
matches,
it's sulfur.
yeah,
not use that end.
No.
You don't put the sulfur in.
Yeah,
Oh, yeah.
you do. You burn it.
I thought you always did the backside.
No,
That is.
yeah.
But I just don't use wooden ones, because these are a little harsh, if you try to put those back out, you're gonna get splinters. So, matches work. And I don't know why, but they do. I don't know who decided that they should do this, but in the obedience ring, if your dog poops in the ring, you're disqualified. So we know from the obedience side of things that the people with obedience dogs always match their dogs, and some of the handlers match their dogs too, when they go in the ring, just to keep them from having slow. So it works really well, and the people that don't know about this look at you like, what? Like, what's your story?
I think that's the handlers, pro handlers all smoke. And they, I wouldn't have that hand.
I know, they're standing outside the door,
Matches with it.
right, they're standing outside the door going, no, no, Joe, what do you think?
Can
If
we
I-
use the light?
If I put this in, do you think she'll poop? Yeah. Well, I had a breeder client one day and I couldn't find my matches and I was trying to do a TCI on his dog and I said, Greg, you have any matches? And he goes, ma'am? I said, do you have any matches? He says, I have a bit. I'm like, no, no, no. So, this is a little thing, and one of my doctors had an elderly dog that was incontinent with his feces, and so she would match him twice a day just so that she could get him to empty out, and then she could let him, back in his crate or back in the house without having to worry that he was gonna have a stool, because she could predict then when the stool births. So when we do our puppy count x-rays, we do those if we see too much fecal material. And when I do my puppy count x-rays, I always take 2 views, one on their right side, one on their left side. I don't care which side you do first. Just for giggles, the other day, we had a dog that I couldn't get a good count on. I'm like, put her on her back, because that's what a lot of vet clinics do. They put them on their back. Oh yeah, there's no way you could possibly count. Never works. So they have to be on their side. So right side down, left side down, and it works really well to get an accurate count. What's this stuff?
It's
Puppy crack.
Puppy crack, starter nurse. What's that? It's like coaching. It's a crack. Yeah, puppy crack. So this stuff will get puppies weaned, and you can't get them to wean any other way. I wean 12-day-old puppies with this. If I have a sick mom and she just can't produce enough milk because she has mastitis or she's sick, we can get puppies to start eating this solid food really easily. Now Purina has started making one as well. So if you can't find Royal Canin, Purina makes one. They started June 1st. I was just at the Purina booth on the veterinary diet side and they didn't have any idea what this was. They looked at me like I'd lost my mind. Like, no, really, you guys make a starter mist. They're like, And then they looked it up and they go, look at that, we do. So, it works great for getting the puppies to eat. It works great for bitches that aren't eating well because they're pregnant and they just feel icky. It works great to get a bitch to drink. You can just open a can. My Royal Canin rep says, just throw a can of the water. I'm like, no, Liz, you have to take the lid off first. So take the lid off, then whisk it into the bucket of water and the bitches will drink because it flavors the water. So it's a good way to get bitches to drink if they're not feeling up to it. And then after they're weaned, then we switch home to a starter diet.
I water that down.
That's starters or that's the, and it's
The kibble, I soak it in and then I mash it.
and that works well too, but the first couple of days, the starter mousse is just, it's just a really good way to get them started. My corgis wean at 3 weeks, my farm dogs don't wean until they're 8 or 9 weeks, it's just, every breed's a little different, every
Wow,
dog's a little different.
really, 8, 9 weeks.
Yeah.
They love their moms and their moms love them, and if they have teeth, they don't care.
Yeah.
They keep them
Wow,
warm.
the
And
mom
teeth-
still lets them nurse with those teeth. No less.
Yeah, the
Wow.
corgis are like, no, get away. Yeah, it depends. All right. Royal Canin makes the only pregnancy dog food on the market. HT42D. What does it stand for? HT?
42.
42nd day. Yeah. So we feed it from when we wanted to come into heat until the 42nd day of pregnancy. So this is the Royal Canin diet that if you're getting bitches that won't come into heat, I would start this.
Okay.
And if you email me, I will send you the micronutrient profile of how this all fits into the process.
But keep giving photographs.
And that's fed to, like, say that for someone who's not coming into heat
Yep.
or during pregnancy.
Yes.
Both.
Yes, and it has a micronutrient profile that reduces the pellets. It has better formation of placentas. It's just all the way along a better.
All the way.
Yeah.
So what does it do for a bitch who won't come in season?
It just helps them to come in.
Can you tell me the switch on?
All the balance of the nutrients that they have is specific, you know.
It's also got an antioxidant fatty acid profile that improves fertility in male dogs.
Yes, I'm trying to. My son.
So-
Not my son.
So it's a pretty nice diet.
Could you use this as a topper,
You can use it as a whole.
or does it need to be full?
It's meant to be the whole diet. It comes in two sizes, small dog and large dog. And if you don't know what you have, then I'm gonna try it out. You need to find somebody.
That's nice that it comes for the large dogs, because it's
Yeah.
very hard to have specialty foods for larger breeds.
Yeah, they make a large breed product. This is large, this is small. They changed the packaging, but
Do they make a medium?
no, it's either large or small. You have to pick. Big dog, little dog. That's all you got. I know you're kind of in the between. I do large
Yes,
dog.
we're in the middle.
I do large dog. Now, I would tell you it's not the most palatable diet on the planet, but it's really not meant for palatability. My corgis will eat cardboard, so they'll eat it.
And maybe it's sticky.
The only place you can buy it is the Royal Canin Crown Partners Program online. They don't sell it at the store. You could go to 100 stores and never find it because they don't sell it there. I keep a stock of like 1 or 2 bags, but that's just a little bit. So you sign up for the Crown Partners Program. You don't have to pay to sign up for it. This is their breeder program. Once you do that, they'll drop ship you the Royal Canin Starter Moose. They'll drop ship you the HT42D. Then they'll send you little goodie bags to send home with your puppies because they want to keep them on Royal Canin food. So this is the Royal Canin Crown Partner.
I think it's 7, I think a year. 7 puppy packets.
Oh, that's pretty good. You have small ones.
Yeah,
If you have 14 puppies, then that's.
That's what we just had.
Oh, what breed?
Wow.
What breed?
Golden.
Might as well
Our
start.
first litter.
Yeah,
Wow.
might as well start out big. Go big or go home.
I'd go home.
All right, let's see. Nomograms. Nomogram is a titer that is interpreted based on when the bitch's antibody levels that she passes on to her puppies will drop low enough that the puppies will respond to vaccines. The only place I know of that runs it is University of Wisconsin, the Cabin Lab, CAVID. That's Lori Larson, used to be Ron Schultz. Ron Schultz passed away about 2 years ago, and Lori has taken over the lab. So you send in your blood sample on your bitch, not within 2 weeks of the time that she has her puppies. Because within 2 weeks either way, all of the antibodies in her body are going into her mammary glands. So your numbers are going to be off if you do it at the time of loading. So you can do it at the time of the ultrasound. You can do it when they're drawing blood anyway for progesterone levels to time the bitch. You can do it after the puppies are 2 weeks old. And then that still gives you enough time to get back the form, and she will tell you, vaccinate for distemper at 8 weeks and vaccinate for parvo at 11 weeks. She will tell you specifically when to vaccinate for what, based on that.
that's amazing.
It's really great, especially if you have dogs that you're concerned about over vaccinating, because a lot of people are concerned about vaccine injuries, so they want to minimize vaccines. And that's a way to do it and still safely protect the puppies.
One litter we had, the first DAP was due at 12 weeks. That was the first time we covered puppies till the next 10 weeks about that.
Mine was 18 weeks.
Yeah, and then the next one, yeah, we had 19.
And then we send them in and they'd always say, oh, is this the one that's from Sunny?
Yes.
Yeah.
Yes.
Yeah, so if the bitch has really high antibody levels, then she's gonna pass those on to the puppies in the colostrum. So you just want to follow those instructions. And I always send home an extra sheet of paper that explains the nomogram. It's pretty well explained on the form itself. But I send home an extra copy just with some extra language, because sometimes the veterinarians see these puppies want to vaccinate them anyway. And that's pretty frustrating, because many of them went to school at Wisconsin, where Lori Larson was their instructor, and it's like, were you not, they're the days that immunology. Well, but this is immunology, they should have had plenty of time to listen to immunology, so that's a little frustrating to me when they don't.
When did you say it was best to have that blood drawn?
Not within 2 weeks of welcome,
Okay.
so
Any other time.
like at the pregnancy ultrasound,
Okay.
if they ultrasound and they go, oh my God, you've got 14 puppies, right? Then do it that day, or do it after the puppies are 2 weeks old.
But it still takes some time to get back.
It takes 4 days once it gets to the lab to run, so if you're sending it in right at the time that they're gonna be turning 6 weeks old, you're gonna be having rid of those.
Yes.
So you're better off to do it a little bit of time. Some people do it at the time of the breeding, but if she doesn't get pregnant, then you didn't need a woman test. If she's pregnant at the ultrasound, that's a great time. Because typically in our practice, we're doing a progesterone level of that place anyway, so we're already, but we might as well draw my test for blood for it.
Question,
Yes.
so when you take, the blood, that's done at your vet's office and they send it in?
Yeah.
Time of the ultrasound.
Yeah, and if your vet doesn't know about the test, you can go to the website, print off the requisition form,
We'll
and
be here.
trot in with the paperwork. So you can just say, please just draw the blood and I'll ship it, you know, they don't have to make it complicated. But a lot of veterinarians don't know about it, so don't be shocked if your vet says, I've never heard of that. Just be aware that you can ship it, you can help them out by bringing the form in.
There's also directions on for them, for the clinic to do this
Right.
if they're not familiar.
Right, so it's at the Cabot Lab, it was Rothschild's and Blair Larson. And we know that the titer on the dog drops 50% every 2 weeks, so they just graph it. So if the titer starts off here and drops 50% every 2 weeks, they know exactly where they meet the line where their antibody level is low enough that the puppy will now respond to the vaccine.
Cool. Great.
To know, invalidated stuff that has been used on the pups. So if we give the pups blood, because of the C-section, technically.
Then we don't know what that's gonna do. Yeah.
We always do.
So that's what the nomogram does, is that if this is the bitch's titer to December, and this is her titer to parvo, and it's gonna drop 50% every 2 weeks, when it crosses this line, is when they're ready to be vaccinated. So they can look at this graph and tell you that this is when you start vaccinating. Because they can calculate this drop of 50% every 2 weeks. So it's scientific, there's true science. All right, this. We're having a good day, the video will provide. Nope, it's not going to. Oh wait, that wasn't the video. This was the, it's still image. So this is an ultrasound of a puppy inside the uterus, this is the kidney. And when we look at it with a circle around it, it's easier to see the kidney. So this is when we're timing bitches for C-sections. This is one of the two things we look at, the puppy's inside the uterus, to see if she's ready to have her C-section, if the puppies are mature enough. So if we can see a kidney, they're ready to go. And then if we can see on ultrasound, if we can see intestinal motility, see this little trickling line right here? That's the puppy's intestine, that bright white line, and when it starts to trickle like that, we know the puppy's intestine is mature enough, they can start nursing their form. So those two parameters on ultrasound help to tell us the puppies are mature enough for the bitch to have a scheduled C-section. Or if she's, like her progesterone is dropping prematurely or something else is going on, she's sick, whatever, you know that those puppies are ready to go. So that's fetal maturity. All right. The trazodone. Anybody know what trazodone is?
Yeah. I think, maybe not. No, it's stuff that, so no, not
You
that.
might be right. It's a dewormer.
Yeah, then, yeah, I was thinking something.
You can find it online. A lot of people are using it. There is no US approved, FDA approved trazodone drug on the market in the United States for any species. Not for horses, not for cows, not for goats, not for sheep, not for pigs, not for humans, not for dogs, not for cats, no species. But you can buy this stuff online, it's illegal, but the company hasn't been shut down
Oh, that's beautiful.
because the FDA can't find them. Their address is a UPS store in Florida. So a lot of people are using this because they can't get rid of coccidia without doing something other than Albon. So they've started to use trazodone. If you look at the website, you go to the trazodone shop, I get an email from them every day, it makes my head fly off every day when I see it. It is not legal, and I would never touch this stuff. I've spoken at groups where I walked into the room and talked about it, and people have come up to me afterwards and said, I've lost puppies to this. And you have no recourse because there is no company in the United States that makes this drug that's legal. And if you look at the labels on the trazodone website or the pre-horse race website, which is the other company that sells this stuff, the labels, they're clearly counterfeit drugs. I mean, It's not hard to figure it out. So you don't want to use tetrazzle ever, unless we eventually have a US drug, and we don't at this point. Now, there is Panazarin. Are you familiar with Panazarin? Panazarin is marquee. Again, it's a horse dewormer. That comes in a great big tube. And it is a legal drug in the United States, but in the great big tube, it doesn't work very well in puppies because it's unevenly mixed in the tube, and so you can't just take a little bit and put it in the puppy's mouth. You need to have a compounding pharmacy compound it so that the dose is accurate. Because in this great big tube, the drug settles out. It's not all going to be uniformly mixed, and you can't really stir it in the tube, and you can't really figure out how much to give. So you want to have it compounded by a compounding pharmacy. So if you have coccidia and you can't get rid of it, Panazarin would be okay. Tetrazzle is not. My preference is Albon, because I think Albon still works very well. There are people who say it doesn't work, but I think it's typically because they're not weighing their puppies, they're not using the correct dose, they're not shaking it well, because just like paint, all of these suspension dewormers, Nemex, Strongyl, Panacure, Panazarin, all of them, Albon, they all settle out. So the top part of the bottle is more dilute, the bottom part is more concentrated because of the settling. So you're not getting an even distribution. So if you get your new bottle, this 16-ounce bottle, you pour it into little 2-ounce bottles, you shake it really well like paint, put it in your 2-ounce bottles, it keeps it more uniformly mixed. And it keeps there from being so much headspace in the bottle, say you use half of it, so half is drug, half is air, that degrades the product. So having it in smaller bottles is gonna help you more. So shake it well, dispense it into small bottles, and weigh your puppies. Don't go, I think she's about 3 pounds. That doesn't count as weight. Make sure you're using a scale. So these are the places you can buy the stuff, but don't. It's approved in the United Kingdom for dogs, but it's not approved anywhere else for dogs. Not anywhere. Australia, Canada, England, nowhere. So if you look at the Tetrazzle Shop website, it was the Pace UPS store, and now it's it looks like a Winn-Dixie store in Florida. It's not the Winn-Dixie store, people. Winn-Dixie doesn't sell this stuff. They're faking their address. So you have no guarantee, you have no backup on the product. It just says their address is Florida. At one point when I looked, it was an apartment building in Orlando. So even compounded drugs have their problems. Does anybody remember about 15 years ago, the polo ponies that died? They unloaded them off of a boat in Florida. And Frank's Pharmacy, compounding pharmacy, had compounded vitamin E and selenium injections for these horses. They were Venezuelan polo ponies. As they unloaded them, they gave them all an injection. 23 out of 25 horses dropped dead on the side of the road because of the compounding error. Frank Pharmacy went bankrupt because of it, because you can't afford to kill 23 polo ponies.
Yeah, that's funny, surprise, ka-ching.
A lot of money. Venezuela has expensive horses. So they lost almost all the horses. So even with compounding drugs, you have to be careful. I typically don't compound if I don't have to. So if you have to use Albon because you have coccidia, they have a guarantee, so I have to stand behind the product. So use a product that's labeled for use. All right. So fenbendazole during pregnancy. Some of you have used this, some of you have not. Who has used it during pregnancy? So fenbendazole can be used during pregnancy from day 42 of the pregnancy to day 14 of lactation. So for 3 weeks prior to 14 days after the puppies are born, to get rid of roundworms and hookworms that migrate from the bitch through the placenta and through the milk and into the puppies. That's what we used. So I've had a lot of veterinarians tell me that they thought this was new information. They've never heard of it before. These articles were published in 1983 and 1979. That seems like not real new information to me. I graduated right in between here, so I've been out of school 44 years. This doesn't seem brand new to me. But it's great. It's a great way to eliminate the possibility of parasites in your puppies. So if a bitch ever, when she was a young dog, had roundworms, they will insist in her muscles during the pregnancy and lactation. They will reactivate, start to migrate, go through the placenta and into the puppies if it's roundworms, and if it's hookworms, it will go through the milk and into the puppies. So roundworms go through the placenta, hookworms go through the milk and into the puppies, which is why you can have puppies as young as 2 weeks of age that have parasites. So using the fenbendazole protocol will eliminate that. This is the fenbendazole protocol, it's the typical fenbendazole dose, 1 cc per 4 pounds of body weight. I don't use the paste again because it doesn't uniformly suspend. Once a day from 3 weeks before the pregnancy ends to 2 weeks after the pregnancy ends, so a total of 5 weeks. So I have people that come up to me after they've had 40 years of breeding experience and say, Dr. Greer, I've never had such a healthy litter of puppies, because their puppies don't have worms. At about the time you're trying to wean at 3 and 4 weeks of age, the puppies have parasites, they don't feel good, they get diarrhea, you come into bed, you spend money here. You could have avoided that by doing the deworming.
And my girls don't like the taste, and they bite me, so I just stop.
They don't like it. You can use the granules, you can use the suspension, they don't like it. You gotta
I
decide.
think
if
the
it's worth the fight.
granules worked better for me than the liquid.
Yeah.
Cause for the larger, I was doing.
Yep. So, getting back to using your scale, weighing your puppies, using a small bottle, use your disinfectants. And then, I learned from Laura Reeves, my Pure Dog Top friend, if you have puppies that are hard to weigh when they get to be about 3 or 4 weeks old because they're bouncing around on the scale, you can get a fish scale, you know, the one that you use in your boat with a mesh net, you put the puppy in the net and you hang it from the scale, and now you can weigh your puppies down going on the scale. Works really well. Okay. Let's break here. What do you want to talk about? Nobody has anything to say. Thinking, go on,
I know, I have questions.
Yeah.
So even with the panicure and puppies are nursing, everybody seems healthy, and then the stools start to get a little soft, a little bit colored and yellow. Is it mainly overeating?
It can be, but that's about the right age when you start to.
When I start to see that, it's always in all the documents, all my paperwork, it always seems to be that 2.5, 3.5 week mark where the larger breeds tend to be on their own more, right? I mean, they're just
Right,
more
that's
active.
exactly what the parasites hit too. So you
Right,
definitely
so
want to have
keeping it
some-
still, yeah, bringing it, but also even with that treatment, it can still come.
If you've done fenbendazole, you're not gonna have roundworms, you're not gonna.
Okay, so it might more than likely just be. I've just noticed that at that same time periodically, and they're also becoming much more active.
Mhm.
And at that age
Yeah.
too. so.
Yeah, their eyes open and things start to happen.
Right.
Yeah. All right, did everybody see our pink paw program? Our breast cancer awareness program for dogs and cats. You all know dogs and cats get breast cancer? Dogs and cats, so that's breast cancer too. Yeah, unfortunately, if you keep your dogs intact after the age of 2, many of us have had it or will have it in our dogs. So we've started a foundation with the University of Wisconsin. Dan and I have funded the startup funds to improve research on diagnostics and on treatment. Because treatment right now, all we have is surgery. A chance to cut is a chance to cure. Our only chance to do anything is surgical. So we don't have chemo, we don't have radiation, we don't have anything else we can do for dogs. And we don't have good diagnostics because you can't do mammograms on dogs. So it's all done just on feeling. So I recommend that every month when you check yourselves, if you're a female, that you also check your dogs and your cats, just go up their mammary gland chain, go along the nipples and just feel if you have any nodules. If you feel anything that feels nodular or bigger than a nodule, you need to go in and have it checked out. We do have the shirts for sale. We do have dog tags, these really pretty dog tags. These are $10, the dog tags. This is helping to fund research. And then we have this beautiful necklace made by Kessler's Jewelry. Pink Paw is our trademark program to support breast cancer awareness in dogs. So $10 for the little tags, $200 for the necklace. There's scarves at the back. You're welcome to take a scarf for your dogs. If you want a t-shirt, you can buy a shirt. Because I think they're adorable. They're pretty fun, aren't they? Yeah.
I like the paw print.
Yeah, I know. It's pretty good. All right.
Everyone was like,
Mom.
Again. Again. It's very important that you're checking yourself. And I
Both sides.
have women that say, check myself. Yeah, you need to check yourself too.
Yeah.
So you don't overlook yourselves and your dogs. All right, other questions? Yes.
Anybody else notice that runs, usually it's spring litters, and about 5 weeks, give or take, you start taking your puppies outside to run around in the grass, they almost always get diarrhea.
That's it.
I feel it's a Coccidia giardia type thing with spring birds and droppings.
Probably. And almost everybody that raises litters of dogs has Coccidia, Giardia, or both.
Yes.
No matter how hard you try,
You
it's
just can't,
on the grass.
you can't sterilize your backyard.
No, it's on your deck, you know, you try and keep them safe, you try and keep them clean, but yes, there are birds, there are little critters in your yard. And we should be vaccinated for lepto. Lepto is now considered a core vaccine for most dogs. The American College of Veterinary Internal Medicine and the AVMA has changed their stance on that in the last 2 years. And we diagnosed a lepto positive dog about 6 weeks ago here. He came in on a Saturday, I was working, wasn't feeling very good, he'd been out in March the day before with his boyfriend, she's like, yeah, I think he drank some marsh water. Oh yeah, well, here's some metronidazole, here's some fluids, I'm sure he'll be fine. Came back on Sunday, he wasn't fine. He came back on Tuesday, he was really sick, his liver enzymes were high, I checked him for lepto, and he was lepto positive. So lepto does happen.
Has the vaccine been improved for, number one, the reactivity that so many dogs have? Number two, the fact that I don't know if the right word is serovirus, but that doesn't always cover what's endemic to the area.
We still only have 4 serotypes for dogs. We have Ictro, hemorrhagica, Rhicotyphosa, Pomona, and Canicola. Those are the only 4 serovirus that we have. Bet you can all remember those, right? So things like Bratislava. Bratislava isn't one of the strains that we have in the dog vaccine, even though we do see it in dogs. But at least you get some protection from the vaccine. And yes, the companies have cleaned up the lepto vaccine quite a bit. But if you're concerned about it, you can give lepto as a standalone entity and not give it with your December carvo. You can give it as a separate dose. So you have to pick your lifestyle and you have to know. But mice, rats, all that stuff. I mean,
Just getting them.
I have Danish Swedish farm dogs, and do you think I don't have mice in my house? Like, what is wrong with my dogs?
Yeah.
Like, I have farm dogs. I have a video of one of the puppies in the yard at this people's house that I sold the puppy to in Illinois. She's digging up the yard, killing mice. My dogs are like, oh. Yeah.
Yeah,
That
Yeah.
would be my dogs.
Yeah. Olga picked one up and went, ew, it's icky. Great, you don't have to eat it. Let's go. So it's a little later.
One of my Akitas that I placed when I got divorced, he went to the west coast of Virginia, or east coast. And, he came back to visit family and, he got the dog updated on vaccines. And at the time I had said, don't do lepto. And he got here, boarded it with my former vet down south who noticed a lot of peeing in the run. And they asked, can we run a test? And I'm like, yeah. And ran a test, it came up positive for lepto, and I'm like, you know, and I'm thinking, so I called the clinic back east and said, did you put a lepto in? Oh, yeah. I said, my ex asked you not to. Point being that it tested positive for what was in the vaccine.
Right.
And they were like quarantining him because he had the vaccine.
Right, and you will get a high titer for a short period of time.
Right.
But we can't titer for the disease. I mean, when we do titers for distemper and parvo, we titer for the response to the vaccine. The titer on lepto is to diagnose the disease. So it's different.
Yeah.
Which is kind of confusing because I have people that say, no, you can run a titer. You can, but it doesn't tell us what we're looking for.
It made sure it was vaccinated.
Right, and it's a fairly short time that it stays positive on the vaccine.
He was vaccinated within a month of going to visit.
Yeah.
Yeah.
But we can see puppies sick with it and people can get lepto.
Yes, that's why it's.
It's serious.
Somebody that got our puppies, we, handed over the vet records and everything, and they said that their vet recommended not vaccinating for lepto.
Yeah, and that's,
They were getting away from that.
no, they're moving toward it.
Yeah.
In the last 2 years, they've started to push it.
Okay.
When American Veterinary Association, the ACVIN, start to say we should do it, I think we should pay attention.
Your team's view on that is?
Oh, I'm sure, but she doesn't live where they left her.
No, but we've got more and more rain, like the floodings that we had recently in August and all over the place, the climate's changing, so it is true. There was all that extra rain and flooding and everything.
More standing water.
yeah, but you also have dogs traveling
That too, for shows or whatever.
wherever you're going, and so you're, not to say that it's not being transported somehow that way.
Right.
I mean,
Yeah.
you
Right, you
can't
stop at the dog
say-
park and you don't know
Yeah.
what's happening. Yeah, so what else?
don't talk about this stuff. Don't we? Is it, because there's not much to talk about?
It's just a donor.
I think everybody just thinks about their business.
I think we should talk about the stud dog more. AKC just had a webinar a couple of weeks ago that they did about stud dog management. I thought it was pretty good. So you could hop on that. It was $19. I think I'm doing a C-section webinar on November. It's
9 and 17 weekends.
I'm gonna. So I'm doing that. So you can look at AKC. They have that coming up. And then I'm also gonna be at the Royal Canin shows in Florida in December, speaking there.
Do you feel that the, or notice excluding the, sterile stud dogs quite a bit more than?
We see if you remember. Yeah, so the 19th of November is when I do the AKC section one. Yeah, we do, but I don't know if we've just not always looked.
Well, that's, yeah, right, because it's just kind of like, they're there, you're looking at them and then you ask them to check or
Right.
whatever, and then all of a sudden, I've noticed that quite a bit of our top show dogs are not producing like they should.
Yeah, and some of it may be nutrition.
Stress, the whole gamut. just
Right,
like
and we
humans.
have, we have far more sophisticated equipment now to do semen analysis. We have CASA, which is sophisticated semen analysis. So we've got those. I heard the nuclear counter is going away. I don't know if that's true or not. I haven't checked into it, but we have better ways to test the semen now than we used to, because just looking at it under the microscope and saying, yeah, there's sperm here is not enough to say you've got a semen
Right.
analysis. You need a count, you need morphology, motility,
Sure.
longevity, you need a lot of information. And because the computer's semen analysis are so much better, we have those now. And now there's also one called iceberg, and it's about $4,000. So even vet clinics that are reluctant to spend $30,000 on the equipment are willing to spend $4,000 on an iPad that does it. So we have opportunities to do more semen analysis.
So maybe we'll start to see
invariably-
better.
Yeah, invariably, if the bitch doesn't get pregnant, the owner of the bitch says it's a stud dog, and the stud dog owner says it's the bitch. So, and we're never gonna change human nature. That's always gonna be the way it is. So we're always gonna blame someone.
Heat in the summer too. I mean, years ago, when I was involved in the heaters, one of our top breeders was like, yeah, it's a dog laying out on the concrete.
Or the asphalt even worse, yeah.
Yeah, that's, why.
Right, and the blow dryers and,
Yes.
but nutrition plays a huge role. And if we don't feed the machine, we're not gonna get good results. So we have Rogaine, we have Purina. And I did mention, but I didn't really get into a lot of detail about the new probiotic that Royal Canin has. It was introduced in January here in the US. It's Boulard, which is a yeast instead of a bacteria for the probiotic. And it improves fertility in the bitches. It improves the puppies are more uniform in size within the litter. And the puppies respond better to the vaccines when the bitches have been given their product. So it comes in little tiny sachet packets. Florida Flora comes in a sachet that's,
Big.
like big. This is little tiny, and it's pretty great stuff. So it's
What
something.
is your thoughts on changing if you were to change a product like that during, when you just bred a bitch?
If she's already on a probiotic, I probably wouldn't change. If she's on a good probiotic.
Okay.
If she's not on a good probiotic, I would switch.
It's on she's on
Fortiflora
Florida,
is
but
good.
it's like,
Yeah. Yeah, Fortiflora is a good one. I probably wouldn't change that. And Fortiflora does have a digested protein in it for the flavoring, the chicken flavoring.
Okay.
So if the dog does have a food allergy, you're not gonna have problems with it because it's a hydrolyzed protein. Some of them are flavored, some are not.
Mhm.
The Fortiflora is flavored with chicken.
Do you recommend the probiotic all through the pregnancy?
I think it's a good idea.
I
Yeah.
just keep my.
Mine are on it all the time.
Yeah.
They're just, it's just what, yes.
We
Part
see,
of their feeding.
we see less prime mitro, less, mastitis, less metritis, just a whole lot better
Yeah,
health.
our girl had diarrhea for like 3 weeks.
Yeah.
And I called here and they had said to start the Fortiflora, so just. And then the pumpkin and the rice and the turkey.
Right.
But.
You have to be careful with pumpkin.
Why?
Yeah.
Well, if
Oh,
you,
right. No.
well, they can, but not only that, but, and I know, I'm not gonna say it. But I found one of my girls was actually allergic to pumpkin.
There's sweet potatoes.
She was also allergic to sweet
Potatoes
potato.
are a big thing with dogs.
And so I just I was like, okay, so Pumpkin didn't, and that was actually also, Feather had an issue because Pumpkin with the issue that you said that you folks are having with the conclusions, as I like to call them, we could not give Feather Pumpkin. They just made it worse.
Typically, I don't like to see you change more than one variable every time. Because then you don't know. You know, you don't know if the probiotic is making it better or worse, you don't know if the food is making it better or worse. And you want it, it takes at least 2 weeks from the time you do a diet change until the flora in the GI tract changes. So if you're changing every 3 days, that poor dog's GI tract is like,
No, we just did like a meal,
Mhm.
like all together, probiotics on top, and she really couldn't even nibble at all, she just, like, it ran right through her.
yeah. And Hills now has an ID diet for puppies, an intestinal diet for puppies. I talked to them this week and said 8 pounds is not big enough for a bag. I said, if you have a litter of 14 golden retriever puppies, an 8-pound bag lasts you a day. So let's get bigger bags.
So
But
does
it's
that,
new
is
market.
that for just puppies, or would that also do 3, 4, 5 pound dogs?
It would be fine. Little dogs, I was thinking about yours.
Yeah.
Your little dog. It would, and it's fine for pregnancies as well. So if you have a bitch that's pregnant and having some issues, you can put her on the puppy intestinal diet, ID. Those names all their diets, the letter stands for what it treats.
Right.
KD treats kidneys and LD treats livers and HD treats hearts and IG treats intestines. So it's not too hard to figure out those diets.
Amy is on.
Yeah. Yeah, but they make a puppy one now, so. it
Sure,
would
it's
be-
okay for her.
The
Yes.
puppy, like,
Puppy ID, yeah, but it would be more digestible too.
so could you use the bio one?
Yeah.
That one? would
Yeah,
be-
that one's fine too, that's one of the ghost diets, yes.
Because, yeah, I had a couple in my vet down the road, get sent us home with that, and I was like, ooh, they like it.
Yeah.
Okay.
Yeah, the vinyl is fine. Hills also came out, you know, they had a BD diet, the diet for cognitive dysfunction, brain diet.
Yes.
They now have a diet that's a combination of BD for senility and mobility. So it's great for the old dog that can't remember where they're supposed to go, when they get outside and or how to do it.
They've never had both.
Yeah, yeah, but
Either one or the other.
yeah, they put it into one diet now, that just came to market as well. So there's lots of new cool stuff.
So Amy is still on the Prozyme every meal. But you said there's something better.
Well, there's something that may be less expensive, better, it might not be better from efficacy, but it might be better because it would cost less.
What would be, which puppy versus
The
Prozyme?
Puppy ID and the Prozyme, but maybe a generic of the Prozyme, because there's a new one.
Oh, it's only a 60 teaspoon. It's really little.
Yeah.
What was the name of the alternative to Fortiflora? That's what I was gonna ask.
It's Royal Canin Mix, it's a probiotic.
What's it called?
Something, I'm gonna have to send it to you, it's just called a probiotic, but it has Boulardais.
Yeah, that's the word.
Boulardais.
I was like, that's
Website,
Yeah.
a lot of times that's the first thing that pops up is the new
Okay.
program. Right, and then if you click on that, it'll take you where you need to go, but it's like $27 for a 30-day supply,
Yeah.
which is average anyway.
Right. When we were in France in February, we sat next to the pharmacist that developed the product. And she talked to me for 45 minutes, me and Dan for 45 minutes explaining the product, and it's Boulardais. This is very French. Boulardais, like, okay, I got it. So, yeah, you know, the French are, they got their own way of speaking.
Yes.
That's great. Other questions?
Anybody noticing a lot of problem getting frozen semen overseas? Within even time for the canister, for it to survive?
I don't-
We're hearing a lot
Yeah,
of.
there's just a
that.
lot of stuff going on with tariffs and shipments. and all
Yeah,
this stuff.
French was gonna use some of mine, French reader, and she's like, I can't do this.
But I think we're gonna see some of this improve, but right now it's right now it's bad.
So have
You
your
plan B.
Well, even getting a dog there, like, whatever, I'll do the medical station there, you know, they got-
Yeah. That's getting hard.
So when you thaw the frozen semen, I guess, how do you go about doing that? I mean, I know they do it in horses as well, which is really where my background is. And we have used this one particular sterile for years. And they would say that his, for lack of better words, his semen was lackadaisical. And if you had one that swam in a straight line, it was a good day, because they were like swimming surface. But they found out with this particular stud, that if they warmed up the semen more than they otherwise would have, his rate of was higher.
Well, there's a limit to how high you can go before you make it too high. So we have a water bath, semen comes as straws or as pellets. So it depends what you got. Most of the time, the horses are in straws. A lot of dogs are in pellets, a lot of dogs are in straws, just depending. But we have a water bath that's made for thawing semen. It has a set temperature on it, so we don't have to think very hard. Nasco makes that for us.
Sometimes it's what you feed it as well.
Right.
The extender.
Yeah, sometimes different extenders can help. There are some extenders that seem to have caffeine or something else in them.
Mountain Dew Steppers.
Yeah. Yeah.
So it's.
Yeah, so different extenders work for different job. Okay. Other questions? Yeah. That's- All right, anything else? See, you can't stop me.
No. Yeah, did you know that we were participating in stuff?
Well, let's get it work. All right, so we have books at the back, we have t-shirts at the back, we have necklaces and dog tags. They've got the dog tags and necklaces in at the checkout, the same with the shirts and the books if you want to buy anything. This is a limited edition shirt. Not gonna find it just everywhere.
It's cute. Everyone's gonna go like that on your boobs.
Yeah, that's the early person. Yeah, so this is the. Yeah, oh, yeah. So these are like the three. All right, fine. Well, beans.
Thank you, thank you.
Thank you.
Thank you.
Thank you.
Do you know Jill?
25.
25. The shirts are 25. The little dog tag is 10.
Yeah. Yep. Probably do that.
Yes, oh, I know. Great.
Were you going to discuss the DNA testing?
I can talk about anything. I think you go, oh, I just want to, if you feel like they need to like get going, I don't want to hold you up. I'm happy to keep going.
Sometimes I'm happy to stay here all day.
That's probably more than. All right. I'll be around 5. So, DNA, DNA, I took this slideshow together 2 years ago. DNA is probably changing this weekend.
Oh, you mean at AKC?
AKC has already changed. They fired Claire.
Oh, I just sent them DNA last week, so.
Well, AKC doesn't run their own.
I noticed they're talking about color and stuff.
Up until now, Hawkridge, which became 4 of that, yes, has been running Embark and AKCC.
And Bark, I don't consider so
This-
reliable.
This all goes to Lincoln, Nebraska, okay, under the name of what was Neogen, and became Oravet.
Something like that, I just had to change all my dogs and cats and.
And I have on inside information that there's changes happening this week, but that's all. I have. So you could pull up my fingernails and my toenails, and that's all I can tell you.
Well, they said that if you didn't switch over to your stuff, it would be lost forever.
And I would encourage everybody at this point, no matter who you have your DNA with, that you go in and download your PDFs and get them onto your computer, because I don't know what's happening.
Oh, boy.
Well, that's what I had to change. You shouldn't.
So, International Partnership for Dogs, IPMD, is an international organization that they're harmonizing they're helping harmonize DNA testing. Because Palbert runs about 350 tests, AKC runs about 300, Embark runs about 300, they're not necessarily the same ones. So it's a little bit confusing why if this lab is running all of them in like in Nebraska, why these aren't reporting out the exact same thing. There's just a lot going on right now in the industry. I'm not sure exactly what's happening with Neogen, but something's in the wind is all I know. But International Partnership for Dogs is a really good resource of information. They are a nonprofit. I am on the board. Of course. So they're a good resource for information and they're not swayed by anybody. There is no organization in the United States that oversees DNA testing for dogs and cats. So it's kind of the Wild West. If you decided tomorrow you wanted to go home and set up a lab in your back, you do it. I wouldn't recommend it. But you could. So that's part of the problem, is that we don't really know, and then in the next few days, we should know more about this happening, but I mean, quite literally, it's supposed to be happening this week.
Yes. The question with that then is, how do you know that that test that you have is accurate? We don't.
You don't.
Well, that's the problem, and I can give an exact example right now. My puppy that's the odd color, that I said I was sure looked lilac, sent it to Wisdom Panel. It comes back and it says, yeah, he's a domino, but then it says, no, he doesn't carry the dilution factor. He's not a lilac. He's a brown with a deletion gene and his red intensity factor. I'm like, you can't explain why he's kind of fawn colored, but yet I'm actually questioning whether or not there's what, because it really doesn't explain it.
Right, and some of the tests don't apply to your breed, they'll run
Right.
350 tests and you'll get 3 things back that you've never seen it in your breed, so
Yeah,
why would you worry
Like
about it?
fawn, they say one of the dogs, Carson carries fawn. Fawn isn't in the finished lab, but it's saying that he's got it.
Right. Right, and there's some linkage genes, so they won't actually test for the marker, they'll test for a gene next to the place they think the marker is. And so this is the problem, is that there's a lot of confusion, and then the general public gets hold of this information, looks at your stuff on Facebook, and then starts condemning you for how you make breeding decisions. Where they don't know anything about DNA, and even those of us who know about DNA get confused about it.
Yeah, it's pretty,
How
I
can
mean, basically we
Yeah.
have black, a gray dilution, or recessive, black and white. I mean, it's not complicated, but I mean, we also have other cystinuria. Newfoundland.
Oh, and our
We don't
birds
have
take it away.
the variety that many of them do, but I mean, cystinuria now can be cleared by parentage because they found that marker, but
Right.
But that's
Still
still
have
having
to-
the parents are.
well, the parents, but then also I still do a test on it because I don't trust cleared by
Well,
parentage.
I'm looking at my dog and going, I see one thing and you're telling me something else. And why are you not calling my brown wolf stable Carson who's here today? You're not even calling him a wolf stable. You're not calling him anything. Well, I'm sorry, but I'm seeing a wolf stable as my eyes are blind.
Right, so there's a lot of
Yeah,
confusion right now.
interesting.
So I think DNA testing has its place, but I think that people are relying too heavily on it, and I think that's where it goes, as Jean said, that they shouldn't be.
Yes.
And you can absolutely breed carriers,
Oh,
as
yeah,
long as you breed them correctly.
right.
But the general public finds stuff on your Facebook page, and then they come and tell you how to run a breeding program, and you don't know diddly about it.
You don't really need to.
I did, but I
Need to know.
I had, I bred to a carrier, but I knew that mine was clinic, so.
Yeah.
Right. And then I get the puppies clip, I test it, right?
Right, and they're clear, yeah.
You just,
Like Reese came back, was cleared on, there's only one gene.
Well, that's the same thing for healthy, one gene. How can you be dominant with only one dominant gene? Because it's recessive. Well, his is good.
It's
So the DNA tests we have for parentage, breed, traits, and disorders and diseases. Those are the 4 categories of COI. Then you can take COI.
That's another.
That's a
That's
big
about
issue
another-
in Latin.
Yeah.
Now,
It's a big issue in a lot of breeds.
yeah, they're like, oh, we want, and they're like, there, all over the website, whatever, oh, we have this COI. And I'm like,
So low.
yeah, and that's why all your dogs look different.
Yeah, and the judges say to us, how come the dogs, you can't identify them by breed across the, yours are
Across the
consistent.
country completely. That's
Right,
right.
you gotta breed.
And we're fighting with ours as well, as
Yeah.
I'm doing some, probably more inbreeding this for my colleagues and cohorts would like me to do, but you can't tell what breed it is until you have some consistency.
It's inbreeding, you pull out the ones that have problems, when you've got a clear inbred dog, that is a clear dog that's gonna pass on good genes. People forget that piece. They see Kentucky or something.
The coefficient, high coefficient scare me.
And some people have gone too far in either direction, so it's.
Yeah.
Then we have Embark that has a parent predictor and a matchmaker system. It's just a marketing technique. Basically, parent predictor is what dogs you have in your kennel that you can put together. Matchmaker is how you find other dogs outside of the kennel, so.
Yeah, but they're the people that have had blood sent in from humans and identified what dog breed it was, that's how accurate they are.
So there's a lot of confusion, there's laboratory error, and I think laboratory error plays a bigger role than we would like to give it credit for. We're eliminating good traits by throwing out some of the bad ones. Yeah. And there's a lot of things we don't know about DNA. So I think right now it's very confusing, and I personally, there's a test I won't run on my birdies because I know the test is inaccurate. So it's
I know.
difficult. Yeah, it's difficult. So you have to just hope that DNA is going to continue to improve. But we're not there yet.
Great Britain won't use that test either on lappies.
Yeah.
Can I ask you, what do you recommend for breeders? Like what testing do you recommend that they do?
Okay.
Yes.
Do all your
Right.
OFA stuff.
All the OFA?
Well,
Or
you're
is it
asking
something
about
else?
DNA?
Probably depends on your breed or breeds. If your breeds say two different things, if they say hips and one and hips and elbows and the other, then do hips and elbows. So you have to look at where you're coming from.
We did hips and we have a golden eagle, first generation, and so we did that hips and elbows, but then I caught some crap from somebody in a Facebook group because all I did was OFA. I'm like, what else was I supposed to do? I don't know.
There's so much that we're still unsure about. I would be
I'm
hesitant.
going to do the Embark.
Well, I think it's a
That was
bad
what
idea.
I-
I think it's a bad idea, but I would be careful how I interpret. So I wouldn't throw good dogs out of gene pool basically. So I would get some genetics and some from veterinarian that knows something about genes. It's confusing. All right, so, the semen bank. What do you guys know about the purebred preservation bank for our case?
I watched.
Good.
Yes.
You know, when you use it, we should let you have it, and this can be carried forward.
Well, not necessarily me, but somebody, I mean, it's, so y'all know about it? Okay, so the frozen semen that you may not need to use, you can hand off to APIS.
My question is, what kind of responsible
Who's in charge of giving it to somebody?
No, it's not meant to be in the next week.
Yeah.
Right.
It's for meant to be 50 years from now. Okay, your great grandchildren who still own a lappy. Okay, so it's essentially.
It's not for tomorrow, right, yeah.
No, next Tuesday you're not using it. It's really meant for the long term. And we have two very specific criteria that Gerald Bell has written for if our breed gets into so much trouble that we can't breed our way out of it.
Sometimes you need to go back.
Yes.
Yes.
That we have access to the ocean. Rather than to do what they've done in some of the European countries, which is, oh, let's see, Cavaliers have some health problems, so let's breed it to a Danish Swedish farm dog. No kidding. I almost fell out of my chair.
So if you want to hear something crazy in the horse. AQHA, American Quarter Horse Association, is now limiting your frozen semen for 2 years. After 2 years, you still have frozen semen from a particular stud, you've got to get rid of it.
So you can't look back in
You
the
think-
past.
That's bad.
Oh, my
You
God.
think
That's really bad.
This,
Yeah,
and
You could use it, but you couldn't register.
Right.
That's the full thing.
Right. I mean, it is crazy. And so this is what came down, then another person mentioned it, I raised jacks. And they said, God, I hope this is not what's coming down the pipeline for our money. And posted it, and I mean, we had a short discussion at a meeting, and I was just like, they are trying, you know, there are people that are like trying to fight this. But this is what AQHA's board of directors wants to do, is after 2 years, oh, well, if you
Are
have
the board of directors composed of newbies that actually don't have any historical
No.
background?
Are they like
knowledge?
Rita? Are they like Rita?
So just a little FYI,
Yeah.
And I think you can say all the things about AKC that you want, whether you like them or
Not
not,
like
but
that.
they were looking more globally because of this project, so good. It has-
So who has control of that semen?
Your breed club will make the decisions. So a
Yes.
committee on your breed club, so it could be the health committee, it could be your own committee.
Right.
But AKC is not dictating who uses the semen,
Okay.
AKC is leaving it to each individual breed club, because you may have your own set of genetic issues or whatever. You can say it has to be a bitch that's had a litter before. You can say it has to be a bitch that the owner's a breeder of merit. You can say it has to be a
So you
bitch
can
that.
set up those
Yes,
qualifications.
Yes, and they do have examples from breed clubs that have already got their stuff together. There's about 15 breed clubs that have already done that. And so if you have interest in it, then you join the committee and you have input. Now, 100 years from now, you're still not gonna be here.
Yeah.
But at least you're hoping that you handed it off to somebody else that's responsible. And that's all we can do is hope for it, but if we've destroyed the semen, we have nowhere to go.
No, I think it's a good idea if you're not gonna use it, but.
Yeah,
find
and-
a home.
And AKC is starting to make some provisions for collecting semen as well going forward. They've been working on some projects.
So the issue you see is that people, breeding themselves back in a corner, and then now we won't do.
Right.
The same stud dog is out there because he's the flavor of the month, rather than.
And then you changed,
Right.
you know,
Correct.
Right,
So I
we-
think having that, I mean, I find.
It's a resource.
Yeah, it's a very strong
Yeah.
resource for future.
A couple years ago, the Skipper Key Club had an MPS3 and storage disease, and they had a third of their puppies that would develop this disease, and they would develop tremors, muscle tremors, and they would die by the time they were 2. And they had bred themselves into a corner for the very reason that you described. So they had to dig their way back out, and this is the AKC's way of helping the breeders have a path forward in case we run into a situation like that. Yeah.
Do they charge you for donating your semen?
Nope, AKC is funding.
So
So,
where's it stored?
well, right now it's staying where it is. So if it's here, it's staying here. If it's in Kansas City with Zoetis, it's staying there. If it's in Oregon with ICSB, it's staying there. But eventually, they will be moving, they've got provisions made in places like Iowa State for long-term, large-scale storage.
And that would stay the same even if someone sold their puppies, right?
Yes. So they make provisions for it. Is it perfect? No, but it's better than throwing out semen in every day that's happening. Every day people are moving into nursing homes or dying or leaving their breeding programs and, and the semen's being destroyed. So it was a way to get a handle on it before more semen was lost. So there's some pretty important dogs out there, foundationally. And they really were looking for low entry breeds first. So they were a little disappointed when the first breed was a corgi, but it was from a person that had a lot of clout in the dog world. And so it was a way for people to go, oh, she did it.
yeah, maybe I can do it.
So it was an influential person. That moved first, it wasn't me. All right, other questions? Should we keep going? If you need to go, I understand. Not everybody needs to. If you want to keep listening, I'll keep talking.
I'm listening.
Well,
Okay.
Nancy,
Why Amphi?
Good question.
what do you mean by Nancy? Like literally Nancy?
Yes,
Are
there are
we hand feeding the puppies or me hand feeding mom?
adults, young adults, young puppies. Okay. Why would you Amphi?
You were, they got a dog like we had, the answer that had a very bad start, you know, that's how we try to build bonds with them.
Exactly. I planned last week that they lost their poor knee and they had just gotten a new one and the dog liked the wife, but really nothing to do with the husband. I said, well, honey, Jan, you stop feeding anything to this dog. No treats, no kibble, no nothing. And Papa, you start feeding
Food and water.
everything. Everything that crosses this dog's lips come from you and you will be elevated very significantly in these dogs' eyes. So it does help with training, it does help.
And C-sections where the dog hasn't come in, or a puppy that doesn't laugh really well or gets pushed aside all the time, it's a way to even the playing field.
For sure. And feeding has its place. All right. Which of these 4 oral flea tick medications are approved for use in breeding dogs? Fidelia, Simparica, Nextrar, and Vermectin. Good job, everyone. We've been well indoctrinated. I can't tell you how many people come in on these 3. And they're like, well, My vet said it was okay. Well, it doesn't say that on the label, so I'm gonna just tell you what it is. What do you know about the new injectable Bravecto?
I would say it's for too long, if it's injectable. I would
It's
think
a 12-month injection.
Yeah, that definitely makes me need something.
It's actually pretty cool,
But if it doesn't work, you're stuck for 12 months.
but
Or
instead of
it
having,
reacts.
instead of
That's what I
having
mean.
these spikes and valleys in your treatment, because you've given it every month or every 3 months, it's here, so it's actually at a lower level. It's at 10 milligrams per kilogram level delivery instead of 25 down to 10. So instead of doing this, it does this. So it's pretty cool.
And what happens if they react?
Well, we're not letting anybody start it that hasn't already been on a year's worth of Bravecto, because we wanna screen everybody first.
That's good.
So that's our policy, that's not necessarily the company's policy, but my doctors feel comfortable saying, if you've been on this drug, we're okay with giving you.
Yeah, it's that one.
Right, however, the injectable is not labeled for use in breeding animals, I sat next to, I go to a lot of meetings, folks. I sat next to the vice president of the company that makes it, and I said, are you gonna test it on breeding animals, and he's like, it's the same molecule. They're not testing for the injectable, it's the same molecule, and it's in a water base, so you figure it out.
That's like using a chemist to approve a nutritional program for the
Well, I can't argue with you, but I don't think they're gonna put the money into testing.
Yeah, good.
But I tell people, if Merck
But if they're
Send the
already
money.
on it.
What?
If they're already on it
I know, it's the
and
same
you're
molecule.
injecting, it's the same
Yeah.
thing, then it's
It's the same molecule.
breeding, or you're telling us that to use it on a breeding stock and.
So, does anybody know what the active ingredient in Credelio is on the human side? You don't know this?
No.
I showed you the video.
Why?
It's for people that have Demodex in their eyelashes.
Oh, yeah.
And if you haven't seen this commercial, you have to watch it on your cell phone. It's hysterical. Because women that are wearing these big false eyelashes
Yeah.
are starting to have a lot of Demodex. Some people already have without any problems. But with that, and then I was also told this weekend, old men that don't wash their faces very often. I'm like,
Okay, that's gross.
wash your face.
Yeah.
Like, this one, they're not showering either, I don't know. But Demodex lives in the eyelashes of certain people. And so the active ingredient in Credelio is in this eye drop for people with Demodex. And the commercial is a riot. So if you watch the commercial, there are people dressed up as mites. And then the woman that's dressed up as the head mite, yes, there is a head mite. They interviewed her, she's a comedian. And she's really, really funny. They interviewed her on a couple of television programs where she talked about this condition and about being the mite. She's this big, funny lady, just hysterically funny. So please take a minute, just Google Demodex in people eyelashes, because it will give you a good view. All right, so Bravecto is the other one that's labeled, and the injectable is not labeled, but that's the rest of it.
Wonderside,
What's that?
Wonderside,
Wonderside is a natural ingredient.
That's a thing, that's all.
Natural doesn't mean safe. I don't use natural ingredients that are plant-based because not all of them are safe.
that's what they have her on Apple Street.
They're not having any success with their coming in the heat, so I would do some changes.
They had to leave it with all their test.
I would. Sorry. So I would take the dog off the Wonderside and use a product that we know is labeled. Frontline is labeled,
Correct.
Bravecto is labeled, use a labeled product. Because we don't know what Wonderside is doing. It's just because it's natural doesn't mean it's safe.
I
Fox
agree.
Foxglove is a natural ingredient. It'll stop your heart.
Digitalis.
Yes.
Yes.
It'll stop your heart. Digitalis. So yeah, let's not do that. Use, the green use that people have as
Oh, yeah.
landscaping.
Bloody WSUs.
Yes, YEWS. We were in vet school and our instructor was telling us about a case of toxicity where they caught a bunch of ewes and they threw them over the fence and the cattle ate them, and they died so fast that they died with a piece of ewe in their mouth. And the joke is ewe versus ewe, YEW. So they would literally die immediately. So just because it's natural doesn't mean it's safe.
Frontline,
Frontline is safe in breeding animals.
okay. They're
Yeah.
not here, so I want to make sure that.
I have a whole chart. If you email the clinic, I will send you a chart that is all of our urn preventives and all the flea and tick preventives. And they're all laid out for age, safety, and reproduction, all the stuff they need to know. Because it may be 2 weeks, or 2 pounds, or 4.4 weeks, you know, there's all kinds of differences in how young you can start them and all that stuff, but Frontline is safe. So if they're concerned about a tick problem, which they should be,
Yes.
we're in Wisconsin. So, portable, yes, Frontline is safe. Bravecto, those are the products that I.
Actually, I've talked to Gina about to, and regarding the seizures. And, you know, like, dog that has seizures is safely using like, you know, that and start all that thing. And she said, well, this all this testing.
Yeah.
And, it ended, it was at, Frontline here.
Really?
Safest for dogs with seizures.
Yeah.
And dog, like,
Yeah, Frontline.
Dorsey absolutely with, you know,
Yeah.
Gail, absolutely has to have something.
Yeah.
And, you know, but we know that.
Yeah.
That it
So
was,
send that to me, but yes,
Bravecto was.
Frontline is the safest. Does anybody know what the active ingredient in Frontline is?
No.
It's fipronil.
Oh.
In the US, we use it for termites. In Europe, they use it on food crops. It is so safe that Europeans, and the Europeans.
Oh,
are very
Europeans are
protective.
strict.
Yeah, it's very, they use it on food crops. So it's pretty safe. So fipronil, Frontline, any of the products that are fipronil based are safe. Now, if you put the insect growth regulator into it, S-methoprene, you may change that.
Yeah.
But Frontline does a good job with fleas and ticks.
Well, like Rosemary's an extra product, they use a lot for preservation,
Right.
and treats, but it's a trigger for a dog who's sensitive.
It's triggered my son's dog. And I told him to take him off the treats, and he's like, oh, you know that one?
Yes, Donna.
Yeah.
And pine salt is a trigger too.
Yeah, well.
What do you say, what did it trigger?
Rosemary.
Rosemary. And it's,
Rosemary is-
it's almost impossible to find a dog food without rosemary as a juice.
Anything soft has like a soft treat, all of them
Usually
have
has rosemary.
rosemary extract or spearmint extract.
Yeah.
And I was like, oh, that's great. I'd much rather have that, a natural product being, you know, the, you know, but
Oh, really isn't, seriously is
No,
about.
God, if you have seizures,
Yeah.
for humans as well.
Yeah, my son has epilepsy.
Yep. That's, there's 6 things.
So if they email me, I will send them the list, the chart with all the.
Just ask her. Advantix two is what they do.
I'll have to look at that one, because there's so many fancy stuff. On heartworm, on the heartworm side, the only thing that's not safe is trifexis. That isn't tested.
Oh, that's,
So trifexis is the only one, but on the flea and tick stuff, it's about half it is. So you have to just look into every one of them, and I've read every single label and put it all together in a chart, because it was so
Thank
much
you.
fun.
So interceptor class is safe during pregnancy?
And so is ProHeart, the 12-month injectable for heartworm preventive. It is labeled as safe for breeding dogs.
So we use an interceptor class, but when it was time for our dogs to get, they recommended something else.
Yeah, we like Sentinel, but Interceptor and Sentinel are very similar.
well, the difference was is that the bibamycin and oxime is the drug in it. And when Interceptor went off the market, they came back a couple years later and, it was, the drug was US based, but they would not guarantee that after the first year that it wouldn't be. And the other, the place they got it was something
Iran.
like Iran or something, and it was like
They couldn't,
not good timing.
they couldn't vouch for the,
Right. And so that's when we stopped using Interceptor
you said.
after that first year, that it came back on the market and we used that.
There's one more, yeah. it's
I
the
think I would
center
use. No, it's bibamycin oxime. isn't it?
Right, plus.
Yes. Well, that's
Sleep.
All right, what's the minimum time between vaccinations?
4.
The minimum, absolute minimum. Not ideal. Ideal, I would say, is 12 weeks.
It must be
I
two.
would not.
2 weeks,
Yeah.
14 days is the absolute minimum time you should have between vaccines. Because it takes that long for the immune system to respond, recover, be able to kick it again. If you do it more often than that, you're suppressing the immune system. And there are some breeders who are, because they're under the thumb of other people, are vaccinating more often than that, which causes issues.
Especially in, you know.
We
acceptable
vaccinate more than
breeds.
every 2 weeks?
What's that?
I vaccinate more than 2 weeks?
These are large scale breeders, usually.
Oh,
This is how to weigh your wiggly pups with your fish scale. You don't have your option.
Yeah, yeah.
You can buy the bag at Walmart in the laundry department, you can buy the fishing scale in the Walmart fish department. And it's, when I say fish scale, I don't mean the scales on a fish, I mean weighing with the fish scales.
That's hilarious.
Were you doing that for?
Oh, I have to do it when they're sleeping and then you're doing this.
Hope they won't move.
And then they're on a baby scale.
I'm going to. All right, can you read back to that?
Yes, you should,
Should you? Yes.
yes.
So you should not skip Keats. You should
You can even
go
get
back to that.
better lives, I guess.
Yes, I would go 2 on, 1 off, 2 on, 1 off, but, the uterus is healthier pregnant than it is not pregnant. However, it takes a bitch 8 months to get back to a pre-pregnancy nutritional status, so I like to do 2 in a row and then skip and then 2 in a row. Sorry.
So the back to back, no matter what size the litter.
No matter the size of the litter. And when I say back to back, I don't mean this.
Okay.
That's back to back.
Back to back. Yeah, I have to have a little fun. Okay, this is the inside of the uterus at a C-section. There's these grayish, yellowish plaques. And then there's these little cystic structures. Anybody know what this is?
Probably placental sites for the big ones that are in zone.
It's resorption sites.
Resorption sites, oh.
That's what a resorption looks like. And it's got this gray, slimy discharge. And I've had veterinarians spay dogs at C-section because they thought that was a funny. That is not funny. Should you spay at C-section?
Absolutely.
Absolutely not. You guys are so well indoctrinated. Yay. No.
They're
Bitches lose 30% of their blood volumes. What's that?
They're engorged in blood. I mean,
Right.
Yes, yes, they will lose. 30% of their
Emergency
blood
vets really like to do that.
They tell you, they won't do it unless
She
you.
lost the mother.
Yeah. Too many people are being coerced into it or forced into it by emergency clinics. Yep.
Oh, yeah.
The ligatures, the vessels are, the arteries are this big. The ligatures slip,
Huge.
they lose 30% of their blood volume and you take the uterus out and throw them in the fridge. I was just talking to some people over the weekend. What do you do if you're an emergency vet and somebody comes in and they say, but doc, I can't afford to spay her if you don't spay her today at the C-section and she's gonna lose it again. I'm gonna lose her again. I can't afford to do this boy. I know I'm gonna have another accidental bleeding. What do you do?
Put a belly band on your boy, for Christ's sake.
Jesus.
I mean, how can you?
Get rid of the boy.
Well,
A tubal ligation.
yes.
You can easily do it at a C-section. You just tie off the oviducts. So easy to do. And then they don't lose the amount of blood they would. You just tie it off. So I was just talking to a vet tech that's from Madison. We were in New Orleans.
Now.
And she was there. And she's like, Dr. Greer, I called you. I'm like, yeah, I know. What's up?
Because we had time to answer.
Is everything, well, I was in, after the last year, she called. But I just said to her, please come up and visit us. I will help you with learning some of this stuff, but I talked to her about doing tubals instead of space. So there's definitely improvement, but I had that, veterinary student with me one day when I had a uterus that looked just like this, and I said, come over here and look at this, and she goes, yeah. She said, they told me that my bitch had that, and it was a pyometra, and they spayed her at the C-section. I said, oh, no.
And she's still alive.
Yeah, she was, but she went, I didn't have to spay her. Sweetheart, I'm so sorry. Yes, you didn't have to spay her. So don't. But biopsies are a really good idea. So if you find yourself in this situation at an emergency clinic, say, please take a biopsy of that, but please leave the rest of your uterus attached to your body. Because a biopsy will tell us about half of the time why they resolve. Good information.
It will tell you.
About half the time, about half. Yeah, but there's only one place I send it, and that's Chris Permarin at the Ohio State University. He's double boarded in pathology and repro. He's brilliant, and so that's where all of my uterine biopsies go. They're actually doing a second study now. They did a study of normal dogs at C-section, and now we're doing uterine biopsies for studying uteruses for bitches that have recently had a litter that was successful. So they're still doing studying on this.
Well, is it, I don't know if this statement is true, will a pup attach at that reabsorption site ever again? It could.
It'll heal up, yes.
Yeah. It does heal enough so that a
Depending, yeah, depending on the cause. If it's scar tissue, it may not heal well enough. If it's some other reason, then it very well may. If it's a low grade infection, it very well may heal to the point that a subsequent pregnancy will be successful. So this is where all of my uterine biopsies go.
So remember Blair had 3
Yeah.
out of 4. I ended up with a singleton. She reabsorbed 3 out of 4. And then I bred her again And I ended up with 3 puppies.
Yep.
The next day.
So it doesn't always hold true.
That's exactly what happened.
But we put her on antibiotics, or you put her on antibiotics to help with that.
Oh, yes. Can you run brucellosis tests in 20 minutes?
Not anymore.
Not anymore. So let us took their kid off the market. When I started practice, it was made by Pittman Moore, which then became SmithKline, which then became SmithKline Beecham, which then became Upjohn, which then became Pfizer, which then became Zoetis. So over the course of that time period, they weren't selling enough of the test kits, or something happened, I don't know. They kept saying to us, we're gonna take it off the market and bring back a better test, and then it came back the same way. So the only tests that we currently have in-house are made by a Target company, which is a company out of China, and there is no USDA oversight on the tests. So I would not trust the test because we don't have anybody overseeing it to say if it's effective and accurate. So can you do it in-house? You can. Do I think you should? Absolutely not. Maybe screen if you need something quick, but you need to send it out to a diagnostic lab for finalize it. So the recommendation that the Society of Veterinary, which is the group of veterinarians that do repro, is to send them to Cornell Lab for the multiplex test. It takes about a week to 10 days to get the result back, so you don't want to wait until the day she's ready to breed to do your test. So this is how to find the test. And there is a position statement on the Society of Veterinary website that goes through all this information. So if you're working with a veterinarian that's not us, and they say to you, well, we'll just run this test, you can send them to the website, vetherio.org, and they can look up the information that.
So what did you say time frame was again?
Takes about a week and a half. You have to mail it there, and then they have to run the test, and then send you the results, so it's about a week to a week and a half.
And when do you recommend doing the test?
A couple of weeks before she comes into heat, which is,
Work.
yeah, which is also the perfect time to run a SNAP 40X or an Acuplex test on her to see if she has Lyme disease and anaplasmosis or Ehrlichia, so that you still have time to diagnose and treat that before you breed her. We've had an awful lot of females come into heat, get bred, and they get really sick with Lyme disease during their pregnancies. Pregnancy is an immunosuppressive condition. And if you're carrying around Lyme disease and it blows up on you, it's gonna be sad. So we lost 3 dogs, two years ago in March, we lost 3 dogs in 1 month to Lyme virus. AKA kill the kidneys. Yep, all Labradors.
So, what if you have a girl that likes to mess with you on her heat cycle?
Just run it in, just run it over to him. And just tell the stud dog owner that's as close as you can get. She's not likely to pick it up. Again, I mean, if you tested her 2 months out and the stud dog owner doesn't understand that they shouldn't be doing in-house tests, maybe find a different stud dog. More knowledgeable. Sorry.
Find that stuff.
Well, I'm serious.
No,
You know,
I agree with
if
you.
they're not keeping up with the fact that there isn't an accurate test in-house, then maybe they shouldn't be.
So I had a brucella poll at my local vet. Even though I was coming up here for pre-pregnancy. And I got it back by Wednesday. And I was pulled on Saturday.
And if they send it to the diagnostic, like the state lab in Wisconsin, it was probably okay. Because the state labs have their own.
Was IDEP.
IDEX does not have an oversight organization that monitors what they do. Antec and IDEX do not.
Okay, I just know I got a text saying it was.
Antec and IDEX do not follow those guidelines. The state diagnostic labs do. They have an organization that oversees what they do. IDEX and Antec march to their own drummer.
They do
Is
not
that-
do thyroid testing. now.
Is that true for all blood work that goes through either one of them?
They have other criteria that they run negative and positive controls on or values on. But on brucella, we don't know what they're doing because they won't tell us. So we don't know if they have negative and positive controls for their brucellosis test.
So you should find out.
Yeah, just ask who ran the test. And that's a fair question. They should tell you where they're sending their tests. So that's why we've recommended Cornell, because the Society of Veterinary Veterinarians, and I happen to be the head of that committee when it was written. Is there a theme here?
You need to get what you want, you have to have a board and value
Yes.
discussing all here.
Take a long time.
Yeah.
So I was not the person that made all the decisions, because there were really smart people on the committee. I was just in charge of the committee. But there were people who were boarded, people that had written the papers on it, all the stuff, so it was a collaborative effort, I didn't dictate what was written, I'm just telling you how it got written. So that was done in 2022 and then updated in 2020.
I know I send thyroid to MSP.
Yeah.
Not IDEX, because I had just the same sample sent to both spots to check. And.
Yeah.
And Newfoundland's did T4s. but maybe
Well,
she-
and OFA only allows certain labs to run these other tests.
Yeah.
And there's a reason for that.
Yep.
All right.
I have a bitch, yeah, catty, it's a really nice kid that was brucellosis tested and bred, we can see. And she miscarried a puppy and we took her in and they're like, oh, she might have brucellosis. I said, we tested, she's clear. We've got to do it again and send it in. And they lost the test and weeks went by and she's got this puppy in her. They're having to put me on antibiotics. Because of the dog. And, but they had to resend it again, there was so much delay, I ended up having to spay him, and I lost this, this puppy.
Pretty was rotting.
Well, exactly, so we had, but the point was, I doubted, and of course it came back the other day, but they lost it. And then to repeat it, and it ruined my whole breeding future for that, she was a very fine, family member.
Yeah.
It was really, I knew it was, good outfit, and
Yes, so that's the best I can tell you is for now.
Yeah.
Nobody's perfect. UPS loses stuff, FedEx loses stuff, nobody's perfect.
right.
USPS too.
Yep. All right, okay, Eagle brand sweetened peanut snow. Do you know it comes in a bottle and a bag? At Walmart.
A bag?
It comes in a bag.
No.
What do you use this for when you have babies?
Baking?
I
Taking fudge.
Fudge?
I have no idea.
It works really nicely for puppies that are constipated. It works really nicely for puppies that have low blood sugar.
Well, the Carol, sir.
And we use it for our puppies before we do their tails and glucose.
Oh.
They did a study in pigs that showed that if they have glucose on board, then their cortisol levels don't go up as high in the neuter when we castrate them. So we use it on all of our tail and glucose puppies. Everybody gets either K-Row or sweetened peanuts.
Really?
I don't know if it works in dogs or not, but it's easy. If it works in pigs, it
So
probably
I'm
works in
doing
dogs.
Duclaws. Do
Yeah,
that.
everybody gets
So our recent litter.
Everybody gets K-Row. They have it in a little Dixie cup and they have a little cotton swab. They
Okay.
put a little dab of K-Row or Ecos.
Yes,
Sweet
I
nuts,
use
into a
K-Row.
cup, and they dip the Q-tip, so they weigh them, they temp them, they check their urine color, and they swab their mouth with glucose before we do their tails and glucose, or glucose.
For the pain,
Yeah.
cancer.
Yeah, it seems to help cut down on pain.
They use my son in the NICU. But it was interesting, they use sweeties, they call it for babies, it's like, kind of like 7-Up. But same.
It's interesting.
Well, there you go. That's another aha.
Duclaws, how many days after birth? 3?
3 to
Birth
5
3,
is
okay.
typically what I say. It depends on if the puppies are gaining or not. If they're not gaining, especially tails, you don't have tails. I won't do, especially tails, but I won't do tails and rears if they're not gaining.
Occasionally we come up with rears. Fronts
Yeah.
are okay,
Yeah.
rears,
I know, I just took them off of one of my others. Yes.
okay.
So works for tail lice and hip flaws, works for constipation, works for low glucose, works well.
So
So,
constipation is still through the mouth, right?
yes, please. Yeah, you get it oral.
That's that Q-tip, you know?
You get it oral. And then there is a glucometer that you can buy. You can use people ones or you can use the dog one. This is called pet test. It's about $50. And you can monitor blood glucose levels in puppies that are sick. If they're not growing or gaining or don't seem well. Puppies that have low blood sugar have a little increase in be okay. Not running beer. Okay. So you can just stick the bottom of their foot pad with this little lancet. Just a little poke, put the little strip on in the machine, just like people that check their blood glucose and then you can test certain glucose. Now, I don't do that on routine healthy puppies, but if I have sick puppies, I'll do it. Plasma. Who loves plasma? Yeah. Yeah.
I have a gallon in my freezer.
Yeah. So plasma we use, we call it magic fairy dust. Right? Because it does magic stuff. If we have sick puppies or puppies that didn't get colostrum, it replaces colostrum. So it'll give them immunity and it fixes things that I don't even know are wrong with them.
I have,
Do you,
back one slide, I was told that the okay, this is by
This is
my
nice.
neurologist.
Okay.
Nice. Alpha-Track was the best, Alpha-Track 3 was the best glucose monitor, for dogs.
Yeah.
And she said she had a whole reason why.
Yeah.
But
They
I'm
all,
like, that's what I ordered. for
and
my-
that's fine. It's just there's only one made for dogs. This is the only one made for dogs. Doesn't mean it's the best. Just
This
it's
is
the
made
same.
for dogs. Alpha-Track 3 is dogs.
Oh, I didn't know that.
And this
I
has
didn't know
more,
there was one.
it has testing on it.
You had an aha moment.
I did, I just had it
There
on.
we go, I stumped the vet.
All right.
Wow.
Yeah.
whoa, we don't have, yeah.
It's my, it's my daughter.
Are we recording that? Yes.
It's my daughter.
Okay. I'll have to do
And
that.
that's what she.
So-
Oh, so you're attention.
When do you give
Anytime I have a litter of puppies that didn't nurse well,
that do not,
right,
like if they're nursing okay?
yeah, if the bitch doesn't have colostrum, I'll give it.
I
If the
just
bitch died.
say, Dr. Greer, give me plasma. When I come up for my X-ray,
No,
that's
because I
what
mean, I
I
haven't
do.
had to, I mean, you've been.
And I just do it automatic because I feel that my puppies have actually done much better.
So you
when
automatically get it,
They just,
no matter
I'm like, give me
If they're good.
plasma.
if they're healthy.
People don't.
I still
Is
give
that-
it
Okay, that's.
Is that a C-section or natural birth?
natural birth.
So you do
Well,
a
you have
C-section.
You
Yeah.
need to know within the first 24 hours, so if you feel well, then you
Actually,
have problems with
sooner
your
now.
dogs, puppies don't get the nurse, and there's a problem, and you put them.
That's me.
But
They still need to get some.
Jackson, we get down to business.
Yeah, well, we didn't have always,
You get
but I think
changed,
the science
so-
line says you have to.
But it's a change.
You can only do sub-Q though.
You can after a certain amount of time, you can give it CQ. But
So we did it with we have the 14 puppies by C-section here, and they recommended it because she wouldn't have enough colostrum for all of them.
Right.
So we had 8 red puppies, 6 black puppies, so we just did the 6 black puppies with the plasma just so we could keep straight who.
How do
It was
you,
easier to know who needed it,
What'd you
and then
find?
we just fed them, sorry,
Was there a difference?
I think
as far as.
she's saying
Right.
that they did plasma on the one color and the other to get.
So the other.
Yeah,
But
and
how, so then what did you do?
Litter,
Keep
but
the
we
other
probably
colors?
just do- No. So we, I don't know, we
What did,
did
how did you?
every
do that?
2 hours for, no, 3 times in an 18-hour period.
I think it's a total of maybe it's shorter.
And we tube fed it.
Yeah.
And then we alternated, no, only the red puppies nursed them on their 18 hours.
Oh, I see.
Okay.
Oh,
So
you did it. Oh, okay, so you can feed it. Oh,
And could you tell the difference in how the puppies grew? Okay.
Not really. We had littles on both colors.
Which
We
speaks
like
to the
5
fact that-
really little ones.
They clearly the plasma worked because they had the antibodies that they needed.
Yep, interesting. Everybody was healthy.
It'd be interesting to track
We
those,
two
track
of the
those
black
colors.
puppies
to
Developed,
see.
strangles.
Which
Like,
one?
2 of the black puppies.
And they were.
And they were-
They did have the plasma.
Hmm.
I have no idea.
Because I have not seen that as a correlation, but that's interesting.
May not be full.
Right.
I just swear by the plasma. ever
Well, we
since I
just
started
always use
using
it. We always.
Yeah, and we have a lot of
We
plants.
just-
But if we have sick puppies that we don't know what's wrong with them, we give plasma. If the puppies didn't nurse, we give plasma. If the mother died, we give plasma. If we're nervous about it, we give plasma. If we're not nervous about it, sometimes we give plasma.
So you keep it on hand when you're walking?
Yes. It's just an automatic thing, and when I come up for my X-ray count, that's when I pick up all of my necessary items. And plasma's on the list.
And we know
Did
what's
Did they fill it in a bag? Did they, are they individually done, or do you get a bag? Just a bag?
I've been getting the bag where I can refreeze it lately. It is
less expensive.
Yeah,
Yes, a lot less.
Not-
Do you inject or do you do?
I too.
Yeah,
And-
if you're gonna tube, it has to be in the first 12 to 24
Yes.
hours, because otherwise they can't absorb it. It digests as a protein then.
Mhm.
So if you're gonna give it with a feeding tube, it has to be early. I've had one person ask if you can give it with a bottle, I'm like, why would they take a bottle? It doesn't
Well, how
taste
did you give that much, my
Can't make
husband
sure that, yeah.
through a bottle?
Is it based on weight?
No,
No.
it's 16 cc's per puppy. it's just the
And
weight
that's
determines
about,
how.
that's, you know.
Divided over the
Yes.
course
The
of
weight
the year.
determines how much you can give at one time, but every puppy gets the same dose. And we used to get it from Hemopet Jean Dodds, but she's been put out of business by the state of California and their infinite wisdom. So we've been getting it from Animal Love Resources, ADR in Michigan.
I just, it's automatic.
I think,
I-
I mean,
I
yeah,
love it.
and interesting to try, I mean, to see.
Yeah. And ADR won't sell it to non-veterinarians.
Well, no, it'll be here anyway, so.
Nope, not anymore.
I just have a little checklist. I need,
That's all.
yes, but if it saves your puppy, it's worth everything.
Oh, yeah.
So Q, I don't give it, you give it in for Aussie sleep, but that's not the info. So 16 cc's for puppy alive in doses.
And I had a really super tiny little itty bitty litter of puppies. Something. And, God, I can't think of her name.
But she made it, obviously.
Trish.
I thought you were talking about the puppy.
Yeah, she was, like 2.1 pounds.
Yeah, Trish named the puppy pumpkin.
And
It was 2.1.
1 ounce.
What is typical for your?
Oh,
puppy?
2.1 ounces?
Yes.
What is
That
a
is
typical
bad
birth
number
weight?
6.
4 is on the low side for Jax, on up to 8. 8 is
Did
big.
she make it?
Did you? Yeah, she's still alive. She's still alive. She lives in North Carolina and, she is in charge of the household of the North Carolina dogs.
Did she get to normal size?
Actually, yes, she did.
That's
So
a-
Jill that's been sitting here in the back had one of my farm dog puppies that was born last year, the week of Thanksgiving. She was itty bitty, really tiny. The people who had her, she's out of my breed.
This
She
is-
wasn't.
She's
She's not,
you
yeah.
told me.
Yeah, she's not a bitch that lives at my house. They live in Columbus. They called and they said, this puppy's gonna die. I said, she is not going to die. Well, if she stays with us, she's gonna die. I'm like, okay, I'm gonna pick her up. So I drove to their house. They threw her at me on the driveway. It's Thanksgiving. Like, they're here. I put her in the car, brought her back with me, gave her plasma, latched her onto my other litter, which was 3 days older. And I said, okay, to the bitch, Helga, I said, you're going to raise this puppy. And Helga said, no, I'm not. And I said, no, Helga, you don't seem to understand. You are going to raise this puppy. And for 3 hours, I sat on the bed with Helga. And said, Helga, you are going to raise this puppy. And Helga for 3 hours said,
No, I'm not.
and at 3 hours, she said,
I'm exhausted, I give up.
so the puppy never nursed. It was bottle fed and plasma her whole life. Jill has her name is Squirt, affectionately known as Squirt, but they call her Miracle. And she's about half the size of my normal farm dogs, but
That's kind of cute then.
absolutely smart as a whip, absolutely nothing wrong with her. She's great, but plasma, tube feeding, and a lot of stubbornness. We were on our way to Florida, so Jill took her while we were in Florida, and then she brought her back to me, and then she came back and said,
She got bonded with that, I want you to.
"Can I have Squirt?"
You work that hard for them, they get hard to live and get.
Oh, it is, and that's
That's
why
why
she
she
went
went
to
to
North Carolina.
2 ounces.
Yeah, 2 ounces. She was. I mean,
I just
the
can't even.
picture of
like,
Patricia's hand.
A
you can't
mouse,
believe how tiny she was.
like
Yeah.
a mouse. I mean,
I mean, just her legs, her paws, I mean, she just, and it was just like, come on, you've got to live. And I mean, it was,
That's
We-
Pomeranian size.
So this article on the plasma was published in 1992, another recent publication, 33 years old. So if people say they don't know anything about it,
and I think that might have been the first time I used plasma. So that's
Oh, I
kind of
would be
why
nice.
I'm sold on it.
yeah, so we get it in bags, then we
That's-
break it down into.
That's a much,
5 cc tubes.
that's a better.
But, yeah, if you can manage it correctly, but if you let it get warm and bacteria grows in it, then you end up with abscesses, so you wanna be careful. And you can't thaw it in the microwave, you have to thaw it in warm water, not hot water, it's all very specific. how you have to do this. But they raise greyhounds as their donor dogs. Plasma is the fluid part of blood when blood clots, or doesn't clot. The red blood cells are down here, the plasma is the unclotted fluid. If it clots, it's called serum. If it's unclotted, it's called, it's like liquid gold. It is. It is liquid gold. It costs not that much too, but it's about $75. You've gone to a lot of trouble to do that. plan. $75
Yeah, right, it's irrelevant at that point.
So most of you know what this thing is. And Sabili, who doesn't know what this is? Okay, you own stud dogs.
Yes.
No, that's why.
That's what's wrong with me.
That's the only thing.
You
That's
cut
the
dog
only
owner.
thing I like.
Yeah. So we use suction puppies anyways. They are almost impossible to get right now because something happened during COVID. So this is Heidi back when she worked for me the first time. Suctioning a bulldog puppy, so you put this part in your mouth, you put that part in the puppy's mouth, and then the icky fluid falls into the finger. After a big deal.
Yes.
This is, you guys know who this is?
John.
Yeah, Dr. Straw. He's a veterinarian in Marshfield.
Is he?
Yep. So this is him suctioning a puppy, to the earth with a mom, but that is Dr. Straw. Can't call him John.
I know.
I can call him. He was young, he grows up. You know, the first 3 months that John worked for me, I thought I was gonna have to beat him out the door and never have him come back. He was just so freaking lazy. And then, I don't know what happened, but he turned the corner, man. He was bad.
Yes, he was sad.
Yeah, he was bad. He turned into a pretty popular. I love it. I know her energy. This is the other thing I told the young lady who works at the spaying clinic down in Madison about. So this is what we use for resuscitating puppies that don't want to breathe. Oh my. It's a little bit of. And then I
Yeah.
can. No, we've switched to this. I haven't. Notice we're kind of breathing.
Yes.
Very well.
It works.
This is, yeah, they worked, but this works a little better. I guess I should. Lisa likes this better, and if it makes Lisa happy, then you know it.
Yeah.
So.
There's a lot of people using this outside the brain.
Yes, to step up their dogs before they go in, yeah.
Is it safe to do that?
There's nothing in it for some. Good.
I actually used this on our run. He got aspiration pneumonia and he was barely breathing as I drove him to the hospital and I gave him some of that. I just was desperate to keep him.
Yep.
And he's doing awesome now. Bigger than a couple of his other.
Nice, okay. Who has seen this video online, using the makeup sponge?
That is.
Yeah, it's a makeup sponge.
I don't know how it works, because I tried it and it just never absorbed the milk.
You know,
Just sat
They're
on
getting
top of
air.
the sponge.
Yes, there's a lot of stories. They aspirate, they get air.
Yeah.
it is. It's
Little pieces of petroleum jelly or petroleum product that end up as, you know, it's fiber. You can't have it sterile, it's just gonna grow bacteria, it's just, there's a lot wrong with it.
Yeah.
But it circulates every now and then on the internet, so don't do it. If you need to feed a puppy, you shouldn't feed them if they won't take a bottle. So a puppy should gain 2 to 4 grams per day per kilogram of anticipated adult body weight. So there's your formula. The weight gain, we used to say puppies should lose more than 10% of their body weight. Now we say they should lose more than 4%, and thank you to NeoCare again, and they should double their birth weight in 7 to 10 days. Low birth weight puppies have a poor prognosis of survival. And that's.
I don't hold her and take a picture, so I'm not gonna worry about that, but I think I have that.
Low birth weight puppies have an 81% chance of death in the first 48 hours. Large litters have a 4-fold increased risk of neonatal death because there's just so many. They don't have enough placenta with room for all the attachments that they need. And puppies in the lightest 25% of their breed have an increased risk of mortality in the first 2 days.
I'm sure that
We lost a girl.
Yeah. So. Puppies starts it up. There's a lot of reasons we lose puppies, but starvation should be one of them.
Isn't that like carbonadicator?
Oh, no, I think about-
Yeah.
Yeah,
I think it's, I think it's.
So my first time bringing to tooth feed, I went home and Trish showed me how to do it once before I left. And I went home and I said to my other half, we have to start tooth feeding these guys. And he goes, I can't. And I looked at him and I said, shut up and hold the puppy. I said, we have to do it or they're gonna die. If we don't do it, or if we do it, at least we can say we tried.
Yep, 20 years Marty taught us, and she made me do it before we left.
Yep.
Yep, and I totally comfortable doing it.
And tube feeding makes a lot of people nervous.
But you know how to do it.
Do it right. So the formula should be made for dogs, they shouldn't be cow's milk or goat's milk, they should be a nutritional based product that's appropriate, there's amino acids in here that reduce the risk of nutritional cataracts and other disorders. They need arginine, lysine, methionine, taurine, they need all those things for appropriate iron brain development, which you're gonna get in the puppy formulas, and you're not gonna get in goat's milk or cow's milk.
So raw goat's milk, I mean, the try from store.
They gain weight really well on goat's milk, but they have a risk of nutritional cataracts.
We haven't.
Yes,
I
had
thought
one.
that was just the vet Escalade.
And it's black has stuff in it now that it didn't have 5 years ago. So when you're tube feeding, does everybody know how to tube feed? No, okay, so you don't.
Never mind,
You don't start to-
that's the wrong
Yeah.
thing to do.
you don't wanna.
Shut up.
So feed puppy, if you get nervous, there's a video on Revival's website about a tube feed. And I,
To me, the hardest part is measuring.
well, and this puppy is.
Yeah, I
definitely
gotta know
getting
how, someone's gotta hold it
I
right.
just get so nervous.
Because he's flopping around and he's like, I'm not gonna cooperate, you know, I'm just gonna flip myself around here, so it is a little tricky to measure too. But once you've got it measured, you don't really need to measure on every puppy because they're similar in method size.
I'm so glad I got stuck up.
Yeah. Going.
So, and.
You can, if at 2 o'clock in the morning, you're afraid your puppy's gonna die.
Yeah.
You
I
are,
know.
You're amazing what you do.
Yes.
At that point.
so this is actually in this syringe, this is actually colostrum from the bitch. This is a Rottweiler bitch and I milked 90 cc's of colostrum out of her. This is a Rottweiler puppy. So I taught her how to tube feed.
So that, as far as like the mark on the tube, we add that into our APGAR score as we are, before we
For how
tube
far it
feed.
is, yeah.
And we say, okay, this puppy is position 2 on that tube
Wow, you're more
From-
precise than I am.
from the end of the tube, so nobody has to go, which one, where is this one supposed to be? Because we mark it for each puppy.
I don't, I figured they're all close enough. in size.
Yeah.
So this was a lady who had 2 Rottweiler puppies, one boy who was doing really well, one boy who was not. She was pretty sure this puppy was gonna die, so she came in, we showed her how to tube feed. And then this is what they looked like. This is Becky and her mother, when the puppies were about 7 weeks old. So she brought them in, you really can't tell who's who. And so for people who say that the rat puppy is just gonna die, just isn't worth saving, this was him at 9 months of age. One best puppy at match. So don't throw away the love puppy.
Yeah, it bugs me when that people say, oh, is that the one?
Right. They don't really know.
I'm sorry, I made a puppy.
So this bottle looks pretty well, this bottle looks pretty well, this one looks terribly. I go up to the booth every time I see the pet ag people and I go up to them and I say, you know, your bottles suck, and I don't mean that in a good way. And they back at me and they go, you told us that last year, and I'm like, yeah, you haven't done anything different. So now Puppy Warmer makes a nipple that's similar to this, but silicone. So if you're having trouble bottle feeding, the Puppy Warmer nipples, this is what Karen Cusick makes for the club palate puppies. These are funny pictures, good picture, but these are made out of food grade silicone, and they're much easier to use than the average nipple.
I thought all the ones that look like that are silicone.
They're silicone, but they may not be food grade silicone. They may be other, like Karen Cusick's, we don't know what hers are. The ones that you get from China on eBay and other places. Well, I know, but people do, because
The former squirrels and more.
have you seen the bottle that has 4 nipples on it?
Yeah.
Oh, yeah. Yes. They're made in China, we don't know what's in there, so.
No.
All right, agalactia is not the lack of galactic creatures, it is the inability to produce milk. So we can use oxylama, Reglan, oxytocin, bratwurst, root vegetables, and oatmeal, warm compresses, give the bitch plenty to drink and substitute fluids if she needs to. Lynn's favorite thing is to cook up bratwurst. She's vegetarian.
The meat is bratwurst.
So she will.
She says I do, I sent the pictures to Marty, like,
Oh, I'm ready. So all these things will help bring the milk. Root vegetables and oatmeal are used on the human side to help with lactation. Starter mousse, like I said before, you can mix that with your bucket of water, mix it with your food. Bratwurst, for some reason, magically brings the milk, and I learned that from a Newfoundland breeder. I said my husband likes
Lots
tea.
Weird.
Yeah.
Yes, I like beer.
Yeah.
Yeah.
I'm
I do
just
stuff.
They're fun, yeah.
I'm not saying that I'm recording.
Okay.
Okay, other things we do with our exam rooms is to keep the puppies happy.
Yeah.
When we're vaccinating and putting in microchips, like
Oh,
we
geez.
use spray cheese, spray cream cheese, Ready Whip, they love this.
That's Crosby.
That is fun.
That's,
And that's,
that's us.
yes,
That's me.
everything is, yes, and that's marshmallow fluff, so yes. those things work.
Marshmallow fluff.
Yeah,
Yeah.
they love that stuff. It's not for giving pills sometimes. My dogs will take a pill that way. Bit out here.
Oh, the marshmallows, yeah,
I
marshmallows work too,
Is
so
that
those are
like
things
a
you can do.
Pomeranian?
They have a need.
This is what I travel with when I go to dog shows and I need bait.
Yes,
Is
they
you
love
can buy
it.
this cans of these at the dollar store for like $1.
I still have a case of it at home.
They're gross, but they are.
Yeah.
But Twix will eat it, but she won't eat anything else when she's pregnant.
So they have these at the dollar store. Sometimes they're 89 cents at the dollar store. I don't even understand that.
My
Because
dog's
everything's
good.
$1.25 now.
My dog's good for like,
But when you're traveling, you can't do that. This travels in your suitcase.
Yeah.
well, travel that way.
You know, when I go to Orlando, I need something I can do. We use a lot of ginger snaps as well. This is Ralph. It's the dog that, Zoetis uses on their commercials for their Serenia, which is their anti-nausea medication.
Because he loves.
Isn't that funny? Yeah, that's Ralph. So we use a lot of ginger snaps because that also cuts down on nausea.
It works well too on gastric reflux.
Yes.
Annika gets it,
Yes.
a ginger step every night, even though she still gets
Yep.
reflux meds twice a
Yep,
day.
and if I go to the dollar store, they're $1.25, which is bags, it's gonna be $1.50, because everything's going up in price. And if you go to the if you go to Walmart or the other stores, they're like $4 a box, so I just go to the dollar store. These are two things that really help with maternal bonding. Calcium helps. This is Olga. She had gotten this tube out of the garbage can. It was empty. And this is how good the Orocal Plus tastes. So she's like, ooh. And she even had the label. This is my bag. She had the label spun so you could see. I'm like, well, that's a great.
That is a great
Isn't
picture.
that great? It's my suitcase.
Yeah.
Ready to pass it on. I'm on the road all the time. And then the Thunderies collar helps with maternal as well. Feeding puppies, these are the chip dip trays that you can buy at the dollar store. This was made for me by a client. What did you use that?
Yeah.
Yeah, I love these muffin tins for people that have,
Oh, yeah.
this is a little French bulldog.
Oh, my gosh.
Sometimes during the office visits, they get rowdy and so it gives them something to do, but if you have a dog that eats too quickly, you can, this is a ginger snap stuck to the bottom of the muffin tin with peanut butter. So it will keep him busy for long enough for her to do a Zoom call when she's at home. You can just load up the muffin tins, and you can also freeze dog food in broth or yogurt in the muffin tins for the dogs that eat too fast. And some of them just don't do well with puzzle feeders, so the muffin tins can be really well.
That's good.
This is fun. So this is a kid's sandbox that's filled with water and little rubber ducks. Keeps them busy. This is one of my litters. This is not a crossbred litter. This is a farm dog. And these are corgis. I had all of them at the same time and they were eating honeydew melon. So I would just take a honeydew and cut it in half and then slice it so that they would have something fun to eat with. The person who took a puppy from this litter, she called me the year later and she said, "Did you feed that puppy cantaloupe?" And I said, "But they got honeydew." She said, "I cut the cantaloupe and the puppy went crazy because he could smell it." So the recommendation is 100 experiences in 100 days as you're raising puppies. And that can be really hard to do. But during COVID, I went to Walmart and there were 11 kinds of bath mats at Walmart. Shiny ones, not shiny ones, square holes, round holes, bristly ones, all slatted ones, all kinds of stuff. So you can do all kinds of things with bath mats, you can do things with fruits and vegetables other than grapes and raisins. They give you a chance to give them 100 experiences. Because it is hard to do 100 things with these puppies to keep them socially developing. This is the 11 bath mats. No kidding. I'm sure the lady at Walmart.
That
knows.
is like brilliant.
Yeah, because then they have 11 surfaces.
Trying to find them, but
Other
yeah.
than the slatted ones, these go in your washing machine. Just throw them in the wash when they hit poop on them. They come back out and they're great for raising young puppies on because when they urinate on the mat, it goes right through and you throw it in your wash, but it gives them really good traction. Carol Bouchard out in California wanted to sell mats that had holes that were of a certain size based on the size of your puppy's feet. I'm like, just buy a bath mat. Like she's making
Boy,
it,
they were so expensive.
they were expensive. I'm like, just go to Walmart. Man. So, you know, this has got like a bristle, has square holes, this has round holes. There's shiny ones, there's bristly ones, there's all kinds of different ones. So I'm sure the lady at Walmart thought I was really weird because I bought 22 bath mats in my shirt. Things like a full length mirror, really easy to put up on the outside of the X pen so the puppies have an experience. I have a picture of one of my farm dog puppies when we delivered him to the new owner, and we were in a hotel room when he picked him up, and the puppy saw himself in the mirror for the first time. I mean, he was just having a blast looking at himself. Puppies really love these mirrors. You can do fun stuff, and everybody knows about these things that you can build with all kinds of stuff to keep the puppies busy. Oh yeah, National Animal Interest Line says our annual conference, it's over already. We had it 2 weeks ago. So pay attention, National Animal Interest Lines are the good guys that want you to own dogs and all the stuff that they've been working on to help the Dog Rehabilitation Act. This is placental fluid. We save in our C-sections, and we send this home with the females so that they identify that the puppies are theirs, because when they go home.
And I can vouch for that
Yeah.
works, because when Carrera's puppies, even though Carrera always had all of her puppies at home. But when I came back from after having tails and deep paws done, she was like, those are not my puppies, and I'm going to eat them. And I put that in, and she was like, oh, why didn't you tell me those were my puppies?
And you can save this even at a whelping. I just did this with my last whelping, which was a week and a half ago, 2 weeks ago. And there were enough pockets of fluid that I could save it into a cup and then save the fluid. So even if the bitch whelps, you can still do that. And it's very handy for those situations. Or when you bring home the other puppy and Helga says, no, I'm done taking it. And 3 hours later, she did.
The new anesthesia that you use at C-sections has made a huge difference in
Bonding.
yes.
Yeah,
Because-
like even like
because
when they
they're
wake up, they're like
awake right
so-
away. Oh, yeah,
they're
they're the
not-
ones that wanted to eat their puppies, and it's like,
Yeah, I haven't had that one, they're very.
well, not
Yeah.
because, but that new anesthesia, they wake up so much faster,
First
and
litter,
there's so much.
She had no idea. We would lay with her on the living room floor. My daughter would put the puppies on her and we'd have to keep feeding her cheese puffs to keep her.
Yeah.
Otherwise, if she saw them, she would run away. She'd give them on. She was terrified.
Yeah.
But that did help.
Yeah.
But
You get to about the third day and Mother Jane kicks in.
Yeah.
But it's.
And I was like, this
just
is not, we're not feeding 14 puppies. Absolutely not. So, come on.
So Instant Pot. I use this because I had a lot of people when there was all this stuff going on with cardiac disease and diets that were feeding chicken to their dogs, and we know that taurine is in higher quantities in dark meat chicken. And that was one of the keys to keeping these dogs from developing heart disease that were on these taurine deficient diets. So dark meat, not white meat. So when you go to the store, and I have all these people that go and they buy white meat, skinless, boneless chicken breasts, and like, why? Buy the dark meat, buy the thighs and legs, throw them in the Instant Pot, and they come in magically ready to feed the dogs. So I use all the dark meat stuff. This is how I use water. For my puppies, water is the most important nutrient our babies get. Sometimes we forget that, so this is a nice heavy dish, just a pie plate. This is a chicken water, for those of you who don't have chickens. These are nice outside and inside so that they don't tip them over, they don't swim in them, they don't lay in them. And this is a nice way to keep the water clean and accessible to the puppies. As are drinking bottles. So I've used a lot of Lixit bottles over the years as well. You can hang these on your X-Pen or your crate. This is somebody that made a stand for their Lixit bottle. Very handy, you can buy this on Amazon. And it gives the puppies access to water without them swimming. And there's actually one client that had a lab puppy that fell into the water bucket. They made her splash. She did not drown, but it was close. So that's what I have for you today.
Thank you.
thank you very much. Appreciate it.
Well, that's what we have given online, really officially, because it's so much more fun to be in. Yeah, so, if you have any questions, please let me know. I've got to make sure my puppies get in for their eye exam.
What was the oral, or I wrote down oral com, but that's not what you said. Oral com, it's whatever, it's several slides back.
Plus.
Oral the calcium, yeah.
No, not calcium, it was for, we used the collars.
Oh, the thunderies.
Yes, right.
There.
And then, but you said something else.
Good calcium.
Okay, that's what it was. Okay,
That's
oh,
the
you're
old
right.
packaging, yeah, that's the
Okay.
old packaging, they changed. the
So it's not
packaging.
called, it's oral.
Oral calcium. Now, there's Calsor, that's also on the market, which isn't oral calcium, but it's astringent and bitter tasting. They really like this stuff. I mean, literally, she got this out of the trash can and brought it onto the bed because she thought it was so tasty. It's like vanilla flavor. You can come through, it's okay. This is Dr. Almond. So sorry.
So this is the same?
They just changed the packaging.
Okay.
Yes, and then we do have, the wipes back there, which they're smooth wipes, they've been discontinued at Revival, but they're treating the mammary glands, so they're less likely to have mastitis. And they are safe for the puppies, so they've discontinued them, I bought all the ones that were left, so we got some, they're technically outdated, but they're like baby wipes, except they're safe on boobies.
I thought you wanted to leave.
You wanna leave some of the sebum, but this is just like if they go out in the yard and they come into the grass and,
Oh,
you know.
I thought, okay. I got to do it before. Okay.
Yeah, you don't wanna scrub a little bit, but it's just enough to,
Okay.
tight stains out. Or if she has an incision that you wanna keep clean after this section, you can use it on there, they won't hurt the puppies. All right, thanks everybody.
Thank you.